Secretary, Department of Skill Education, CBSE. I'm welcoming you all in our today's session, which is on life cycle medicine and vaccine. Things you should know about keeping medicines at home and what to do when doctor is not around. These all topics are related to class 6 to 8, but it is, I think, is a general topic. Everyone, whether who is related to this particular formula in this subject or not, every general person who is less educated, we can say, or not educated, or a high educated, he or she must know all the basic things regarding all those topics. So let me welcome Manoranjani ma'am and Pyali ma'am. Chandra, come on. Okay. So welcome Manoranjani ma'am. Manoranjani ma'am is principal in Amrita Vidyalayam, Kannapuram, Kochi, Kerala. Welcome Manoranjani ma'am, and I'm so happy that you
Thank you.
are here to share your eminent experience. And welcome Pyali ma'am. Pyali ma'am is always very energetic. I just, I'm just a fan of her energy.
Thank you,
Uh,
ma'am.
Pyali ma'am is PGT in St. Peter High School in Sikandrabad. She is a PGT biology.
Yes.
So I think these two prominent experts will guide us minutely through all those information subject and what we can say the uses of all these things in our daily life. So welcome, Pyali ma'am, once again,
Thank
and
you.
Anjali ma'am. And you, I'm having a query. Please just tell me one thing that in the morning today, I got my foot got stuck somewhere and it was bleeding, and I have nothing to do with it. I have to come like that only. In that kind of thing, what we should do?
Ma'am, when we means suppose if the foot got twisted at any time, so that time you can use that at your home only that with that pan we use na that white color thing that is called as chun
Okay.
in calcium carbonate basically. So we along with that you can keep some turmeric and you can boil it for some time, and after that when it will be cooled down you can apply it on the twisted area where the means you have got twisted in any body part, and it is called as lepa. Actually lepa means it is a traditional Indian name. In our subject this when the doctor is not around, in that book only it is given clearly. So if we apply that, so definitely we will the nerve will be numbed in nature and you will get some relief from there.
मेरा आ रहा है?
आपका और कट उसके बोला रहा है
अच्छा. Pyali ma'am, Manoranjani ma'am, I request you to just once restart your camera. It is not showing on YouTube live.
Okay, okay.
ठीक है जब सारा चल रहा है अभी हम लाइव कनेक्ट करते हैं.
Is it fine, ma'am?
I think think we should continue. Maybe there is some internet issue. It might be resolved in few minutes.
Okay.
So, Pyali ma'am, you were advising me something.
Yes, ma'am. So at our home only, that calcium carbonate is there very much available, ma'am. With pan, we use now one white colored thing. When we eat the pan, we use one white colored thing. So that is called as tuna. We called it basically that white color.
Yes, yes.
That is calcium carbonate. Basically, that calcium carbonate we can mix up it with the turmeric, and we can just make it warm, or one small boil we can give on it, and when it will be cooled down, then we can apply that paste on our part or body part where means the part get twisted. Actually it is called as lepa, lepa, lepa in our traditional Indian name. So if we apply it for 2 to 3 times, you need not to apply any Bolini spray also. Means it is a traditional Indian thing we can use just to get rid of the pain also, because turmeric also has the means effectivity, like effectiveness where we can get rid of the pain. That is a natural home remedy. So that tuna and turmeric paste we can use now.
Okay. Tuna and turmeric paste
Yes,
is
ma'am.
the basic thing which we can do in this kind of situation.
Yes, ma'am, definitely. What is easily available at our home, but we don't know actually what are the things. So, if suppose the allopathic medicine is not available, just using this kind of medicine also, we can get rid of many kinds of problem. That is
Honey
easily
and turmeric is also good. Honey and turmeric mixing
yes.
together, that will also heal.
Manoranjani ma'am, like here, I don't know how weather is there in Kerala, but here in North India, it is this kind of weather is here. Every second person is suffering from cold and cough and fever.
Yeah, ma'am.
So in this condition, what the basic things we can do?
Yeah. So when the climate is warm, getting warm, an adverse climate, and that time it is very important that we need to eat food and which digest very fast. So that is one thing. And when we don't have fever, taking bath daily twice in a day, that also help us to be healthy. And then add more of fruits to our diet and more vegetables than non-veg. So that will help us to maintain our health and we won't get fever and cold very fast. And nowadays after COVID, we know we need to wear mask when we are talking with someone and someone having fever. So these things I think will help us and support us.
Okay, Manoranjani ma'am, thank you. And my even in my family, everyone is sick with cold, cough, and fever.
Ma'am, ginger is also very good. Actually, ginger also has an antibiotic effect also. That is the natural antibiotic. If we drink the warm tea with the ginger, means ginger juice basically, if we add it in our warm tea, but tea should be basically liquor tea actually. We should not add the milk and sugar, and we should not make the tea in that way. And if you add some ginger and honey also, it will be very, very good for cold and cough in this kind of situation. It's very good actually.
So I think we will get so much basic information which is very useful to us in our today's session. And over to you, Manoranjani ma'am and Kyali ma'am. We should start with our topic now. So over to you. Over to
Okay.
you.
Okay, ma'am. So I am sharing my screen, ma'am. Okay.
Okay.
Is my screen visible, ma'am?
Yeah, it is coming up.
Okay, so in the first session, we are going to start with the life cycle of the medicine and the vaccine. That is the subject code is basically that is 914914, and in the first total three things on the total three things we are going to talk today. We are going to talk about, that is the first session is about the life cycle of medicine and vaccine. The second session will be things you should know about keeping medicines at home, and after lunch session we are going to talk about what to do when doctor is not around. So we are going to basically discuss about the different kinds of home remedies that we can use in our daily life, so that we can get rid of the different kinds of problem very quickly, and very much available things that is already there with us at our home. Okay, so the first one, these basically in the life cycle of medicine and vaccine, in this context, total 6 units are there. So the first unit is about you and your medicine. So we have to basically know what are the different medicine we are generally using in our daily life. Like whenever means any kind of problem is coming to our life, basically we prefer like the liquid type of medicine, because doctors also say like that ki when we consume the liquid medicine, basically the liquid medicine will be absorbed very quickly, and it can give the relief very quickly. So, and capsule also, sometimes we go to doctor and we say that doctor, we don't like to take that tablet because it is very difficult to swallow, even it is rather it is means easy to swallow the capsule. So capsule, liquid medicine, tablet, these are the different medicine basically we are consuming. The main objective of this unit is discuss about the role of the medicine in day-to-day life. The students will basically explain about the basic concept of medicine and its invention. That is the how for the first time the medicine got invented. The students will come to know about that. In this lesson, in this unit, the student will explain the various categories of medicine. They in grade 6 to 8, basically this topic is from grade 6 to 8. In that small age only, age group children, they will explain about the various categories of medicine also. They will explain about the usage of medicine. Suppose if any person of their home, mother, father or sister or any sibling or grandparents, if suddenly they fall ill, they fall sick, so the student can be able to identify the specific medicine that is easily available at their home, and if any like elder person is not there, how to handle this kind of situation. In the very small age group, like grade 6 to 8 students only will be able to do that. Okay, so they will explain the different usage of medicine also. The basic learning outcome, the students shall be able to explain about the medicine and its usage, what kind of knowledge as a teacher we have to evaluate. As a teacher, we can evaluate their knowledge based on their explanation on the role of the medicine and their categories. That means, suppose they should know that when we are suffering from the fever, so we should consume the paracetamol. When we are suffering from any kind of like allergic reaction, so that time we can take the cetirizine kind of thing. So that is the common generic name, so that they will have one basic idea of that. What are the different role of the medicine, that they will not be like as per their category, their function and the role of the medicine, the students will know. And how the performance evaluation will be done, they have to identify also. That is the performance. As a teacher, we can bring some medicine in our school, and we that is a hands-on experience. The students will identify, okay, paracetamol looks like this, cetirizine looks like this. So that's why, means that is a simple thing, very simple medication that we take in the generally in our life. Suppose any simple flu or simple allergic reaction, if we take one medicine, so we get relief from that. So the students will be able to do the hands-on experience based on the different kinds of diseases and the different kinds of medication. That, and how can we teach and train the student based on that? Basically, we can give one interactive lecture. Interactive lecture is always that is a welcome thing. We can ask them, we can ask some case study that happened in their life, so they will explain. It can be story based pedagogy also we can involve here. We can ask about the students' life. They can tell about some story where they have implemented their knowledge and they are appreciated. So we also should appreciate them. We also should motivate them to do that. So this kind of interactive lecture, career integrated pedagogy also we can involve here. Like we can give them some ideas that the doctors, if you want to be doctor in future, now you are in grade 6 to 8, but definitely if you take the BPC in future, and if you want to be doctor, you can not only the allopathic doctor, you can go to the Ayurvedic, Ayush medicine also, you can go for the homeopathic also, you can go for Unani also, so many Siddha, so many types are there. Our traditional Indian medication system is also there. So in that way, the career integration as a teacher also we can inbuilt in them, so that they will be thinking, yes, if in future we will be doing this kind of Siddha, like Siddha right now, many people, maybe we don't even know what is Siddha. Many people, we don't even know what is Unani. Homeopath, some of us are very familiar with homeopath and allopath basically, but different type of Ayush, traditional, like the yoga, naturopathy. So we can motivate our students to get interest in the traditional Indian medicine system. Now chalk and talk method is already there. As a traditional Indian teacher, we have that method that we cannot omit. We can use it in a minimized way. And the activity. Basically, the activity part, the students can prepare a list of the medicine that the student and their family member have consumed in the last 1 year. So that will be one simple project. The student can make their own portfolio file, and the student by himself or herself, or the parents or the grandparents and their siblings, or their brothers or sister, what kind of medication, what kind of disease they have gone through, and what kind of medication they have taken, they can make one portfolio or project based on that. And they have to identify the specific name of the disease and what are the specific name of the medication the student and their family members have used, so that we can go through. So just one nice video in this context I want to share with all of you. So that one I will share. Just I will play the video now. This is about the different kinds of diseases and the importance of medication in our life.
Hello, friends. Today we'll learn about medicine and pharmaceutical drugs. Careful, buddy. You often take medicine or pharmaceutical drugs when you're sick. It is a substance intended for use in the diagnosis, cure, mitigation, treatment, or prevention of disease. Earlier medicines were made from natural sources, such as plants, animals, bacteria, and minerals. Nowadays, natural and chemical, both the sources are used to prepare them. An ancient Indian physician, Sushruta, first developed the concept of diagnosis and prognosis. It is believed that Hippocrates was the person who discovered medicine, so he's considered the father of modern medicine. He has written the Hippocratic Corpus, which is a collection of around 60 medical works. You cannot prepare a medicine for any random plant. Pharmaceutical companies do a lot of research and testing in order to make a new drug. Let's have a look at the steps. Research. Scientists study the germs that cause a disease or what makes a symptom occur. They then run possible experiments in the lab to see what chemicals may work. Testing on animals. Scientists examine how much of a drug is absorbed into the blood, how the drug is broken down chemically in the body, and many other things. Then, they'll submit application to the FDA for approval to start testing on humans. Testing on humans. It happens in 3 phases. Phase 1. Here, the drug is tested for safety on a small group of 20 to 100 people. Phase 2. Here, the drug is tested on 100 to 300 people to see how well the drug works. phase 3, here the drug is tested on over 1,000 people to see the effectiveness and side effects of the drugs. New drug application. After successful trials, the pharmaceutical company applies to the FDA for a new drug application. FDA approval. After FDA approval, the drug can be sold. If the FDA grants an approval, it means the agency has determined that the benefits of the product outweigh the risks for the intended use. You know, making a new drug takes so many years and usually costs millions of dollars. Let's have a look at the types of drugs. Most legal drugs are of two categories. Prescription. These drugs require approval from a doctor to buy. You cannot just purchase and consume. Even chemists cannot sell these without the valid prescription. Over-the-counter. OTC drugs can be purchased without a prescription. Some pain reliever, cough syrup, and a few sinus medicines are examples of these. Medicines can be administered by a number of ways, like pills, shots, creams, inhalers, eye drops, and through an intravenous, etc. Most drugs have some side effects. It's always recommended to read the label of any drugs you take and follow the instructions, doses, and warnings. If you experience any type of side effects, stop taking the drug and contact your doctor. Now, you know a lot about the medicine and pharmaceutical drugs. Stay tuned for more videos. Bye-bye.
So here in this video we have seen the basic complete one idea we have got about. So means how the drug means the when any medicine comes in our market, so how the drug first the drug is made, it goes through different kinds of testing procedure. Then only when the safety measure is safety part of the measurement of the drug is properly notified, then only the drug can come to the society. Otherwise, that means any eat the drug, that if we consume the drug and if it will be harming our body, or so that kind of drug will never come. So that kind of belief we have. So that's why sometimes some over-the-counter medicine also we can take. Over-the-counter medicine means the medicine which are basically available without prescription. Suppose some pain reliever, somebody is in emergency situation, somebody is suffering from any pain, so means that time we can go to the medicine shop and we can get some pain reliever in over the counter drug. So and some like medicine for fever, suddenly somebody has got too much fever and the fever should come down. Paracetamol, there is no prescription is needed. We can go to the any kind of chemist shop and we can get the paracetamol very easily. So these kind of drugs are basically called as the over-the-counter drug. And many of us, when we means in online also, when we order for the medicine, we may have seen that for some medication, the providing the prescription is very, very important. Without prescription, they don't provide any medication to us. So those drugs are strictly they means if any kind of medicine shop or any kind of means pharmaceutical shop or online medicine shop, if we are going through, so that drugs are basically based on the prescription. So now in this first unit, basically the core thing what we are going to learn about, that is the free from the illness. So the medicine, what is the medicine? That is something that is used to prevent, cure or relieve a disease, and it can be from a pill or even a liquid. So any kind of thing we can use just to get rid of the illness or sickness. What are the different types of medicine? The first one is called as the topical medicine. Topical medicine are basically the medicine. So these are the scientific name or the generic name. They are basically the creams or lotions or ointments that will be applied directly onto the skin. They come in tubes or bottles or tubes depending on the type of the medicine. So these are basically, we suppose sometime we are using the different type of skin lotion, or if we are getting any itchiness or something, one ointment we are applying. So very simple thing, very simple medication, topical medicine, cream or ointment, simple. We can go to the shop and we can get this kind of topical medicine. But some topical medicines also can be like basically used for the fungal infection or any specific type of bacterial infection. There maybe the means the prescription can be needed. Means sometimes the steroid is also there in some kind of topical medicine. So we have to be very careful in using the topical medicine. If it is generally we can use, means it is not harmful. We means for the kids also that kind of topical medicine we can use. But sometimes if that medicine is containing any steroid medication inside it, or if it is specifically for the fungal or bacterial infection, then we have to make sure that those kind of tubes or lotions or ointments should be out of reach from the kids. That means no means children should get reach out, should not means reach up to the this kind of topical medicine. The next one, that is the different kinds of drops. Okay, that like what we are using basically for the eyes or ears or nose. And in the video also, means whenever we are telling it to our student as a teacher, so sometimes we can see that our students they will not get some interest. So along with teaching, we have to show some video also, so that the students can get the idea how the medicine can be used. In the topical medicine, how to use that drops in the eyes and ears and the nose, because that is the part of basically the skill based subject. So as it is a skill subject, maybe the 6th to 8th grade students, they can't do it by themselves right now. But if we show them how to do this, means how we can use the drops, how we can use the eye drops, what are the protocols we should follow, what are the protocols one nurse basically follows in the hospital to use a eye drop or ear drop, the student will get the knowledge. Okay, this is the way we can use the eye drop or ear drop in the house. This is the way we should, this is the protocol we should follow when we are using the topical medicine. So some kind of video I will also share with all of you, so that you can also get the idea how we can how we can inbuild the interest inside the student's mind, the student's young mind, so that they will be they will show more curiosity about the different types of medicine and their usage. Another type of medicine that is there, like the inhaler, that is very common medicine nowadays. When we started our session, then only Jyoti ma'am was sharing like that now everybody is suffering from flu and everybody is having the problem of cough and cold. So nowadays, when we all are suffering from flu and cough and cold, sometimes means we also feel very much lethargic to go to doctor also. How many times should I go to doctor? Because the way that sense time, every time we get that kind of breathing problem, too much cough and cold. In case of the children, also suppose we are also the parent, when we have our own kids at our home, and they are feeling too much cough and cold, sometimes we get puzzled. What should we do? How many times should I give the medication? Is it really good to give so many times medication? So that time, sometimes doctors, they prescribe the inhaler, and it is safe to use. There is no problem. For the kids, we can use the spacer to give. That is one kind of device. By video, I will show you how we can use the spacer. And in adult, basically we can take the inhaler directly. Now next one is the injection. Injection to everybody we know, and we all are scared about injection. Being a teacher, student, whenever as a teacher you will also talk to your student about the injection, they will also be scared because they are taking so many vaccination. So they all know. So we have to make them aware about, as a teacher we can make them aware about the different types of injection. All the injections are not painful. Some injections can be given only on the surface of the skin. Some injection can be given in the muscle, that is the intermuscular injection. Some it can be very, very painful if it is given in the spinal cord, like the epidural. So these, what are the different types, we have to make them aware about. So now one by one I will share the videos with all of you. You as a teacher, you also can share these kind of videos with your student to get their interest. The first one is completely about the topical medicine, how to use the topical medicine.
Which would be the medication, and we'd have our gloves, knock on the door, and wash our hands. Hi Annie, I'm Myra, I'm your CNA today, and I have your medication for you. And then we'll close the curtain for privacy. If the topical medication is a prescribed medication, you'll get that from the nurse, and then usually that's going to be in a medicine cup. If you have a medication or a lotion that has something healing in it, a lot of times that's applied to open areas, especially on the coccyx. And as you're providing cares to the resident, you don't want to get anything that's on your dirty gloves into the container. So we want to have a barrier for that. So you can put that on a paper towel, and then with your gloved hand, you can put that on the affected area on the skin. And with topical medication, we want to make sure that it is absorbed by the skin. So we're going to rub that in until we don't see it anymore on the surface of the skin. Does that feel okay, Annie? Any pain? Okay. I'm going to remove my gloves. Wash my hands. Are you comfortable? Okay. Give Annie your call light, make sure the bed is lowered and locked, and then report to the nurse that I gave the medication.
So this is that is very simple thing. We have seen that is nothing too much, very much a huge thing is done here by application of the topical medication. But one simple protocol we all have seen here that our students should be aware about. Because whenever we are applying any kind of topical medication in any kind of patient, we should wear the gloves, because when we are touching the topical medication, sometimes we also can get the irritation in our fingers. So that should not be done. We should wear the gloves in proper way, and we have to ask the patient also, are you feeling comfortable when I am applying the medication? Does your itchiness come down? So that kind of some basic protocols are there that we can implement, and we can, as a teacher, we can teach our students to implement at their home also. Simple thing, very simple thing, but they can implement at their home also in the professional way. Why they can implement in the professional way? Because they are learning the skill subject. So that is the main magic of the skill subject. Key means as a teacher we can integrate the skill among our students from in their very young mind, so that whenever they will be doing any kind of work or any kind of some simple thing also, but it should be done in a professional way and everybody will appreciate them. Now the next one, how to use the eye drop. So one video I want to share with all of you, so that our students will also get one idea how to use the eye drops.
I'm going to administer your eye drops.
To instill eye drops, perform hand hygiene. Apply clean gloves.
I'll go ahead.
Ask the patient to look up.
If you would just look up.
Using your non-dominant hand, hold a clean tissue on the patient's cheekbone, just below the lower eyelid. Gently press down with your thumb or forefinger against the bony orbit to expose the conjunctival sac. Never apply pressure directly against the patient's eyeball. Rest your dominant hand gently on his forehead, holding the tip of the container 1 to 2 centimeters, or about 1/2 to 3/4 of an inch above the conjunctival sac. Instill the prescribed number of eye drops. If the patient blinks or closes his eye and the eye drops land on the outer margin of the eyelid, repeat the installation. When you're using eye drops that may have systemic effects, use a tissue to apply gentle pressure to the nasolacrimal duct for 30 to 60 seconds per eye. Again, avoid putting pressure on the eyeball. Ask the patient to close his eyes gently and briefly.
So this is also one very simple thing we have seen here. Like when we are applying the eye drops, we as a student means as a teacher, we have to train our student in a way that they should know what are the different protocols when they have to press the lacrimal gland, and what is the distance when the eye drop should be put in the eyes. So in being the age group of grade 6 to 8, these students only can help at their home. Suppose the grandparent has gone through any cataract operation, so maybe the parents are busy in their work life, so the kid who is present at the home, very simple way, they can use the gloves, they can use the simple tissue paper present at their home, and if they know the protocol how to use the eye drop, simply they only can do that. Sometime in India we are suffering from conjunctivitis, so by the time suppose the parents are affected, the students also can help in their home, just to their parents also to get rid of the conjunctivitis. Now the next one we are going to see about the administration of the ear drops.
Ear drops or otic medication. Ear drops or otic medications are usually formulated as solutions. Before instilling an ear medication, verify the healthcare provider's orders. Compare the medication label with the information in the Medication Administration Record, or MAR, twice, and then do a third check at the bedside. Also, check the expiration date of the medication.
Raise you up a little bit.
As you proceed, keep in mind the 6 rights of medication administration. For a quick review, see the video skill ensuring the 6 rights of medication administration. If the patient has ear drainage, apply clean gloves. If the position is not contraindicated, have him lie on his unaffected side, with the ear to be treated facing up. As an alternative, he can sit in a chair or on the side of the bed, using his own hand to stabilize his head. For patients older than 3 years of age, gently pull the pinna up and back to straighten the ear canal. If the child is 3 years of age or younger, gently pull the pinna down and back. If the outer portion of the ear canal, the external canal, is occluded by cerumen or drainage, gently remove it with a cotton-tipped applicator, taking care not to push the cerumen farther into the canal. Hold the dropper 1 centimeter, or about 1/2 inch above the ear canal, and instill the prescribed number of drops. Ask the patient to remain on his unaffected side for a few minutes. Use one finger to gently massage or lightly press on the tragus of his ear for a few seconds. If ordered, gently insert part of a cotton ball into the outer portion of the ear canal to keep the medication from leaking out. Do not press the cotton into the canal. Dispose of your used supplies and gloves. If you used a cotton ball, remember to return in 15 minutes to remove and discard it.
That is also very simple thing, but in very general thing, but in very simple way we have seen how we can use the ear drop. Now the next one is about the basically how the inhaler can be used.
Inhaled medications. Before using an inhaler, make sure the counter is not at 0. When your child uses an inhaler with a spacer, the medicine is sprayed into the spacer. As the child breathes in, it pulls the medicine into the bronchiole and travels all the way into the lungs. In this method, about 70% of the medicine in a single puff reaches the lungs. When your child uses an inhaler by itself, the medicine is sprayed into their mouth. Some of the medicine gets caught in the mouth and the back of the throat, and the rest is inhaled into the bronchiole. This way, only about 40% of the medicine in a puff reaches the lungs.
So this is also one important thing, like we have seen that how the medicine can be used here. If that is the child, so basically we can use the spacer, because spacer is the one kind of device, it is like that when we inhale the medicine inside the spacer, the medicine directly go to the lungs. So, and in this time, almost 70% of the medicine can reach up to the lung. But when we use the simple inhaler, then only 40% medicine basically goes to the lungs. Why? Because in the mouth cavity and in the throat only maximum medicine will stuck up. So in the lungs, very little amount of medicine will go. So how to use the spacer and how to use the inhaler, we can train our student to means just to see it, so that at their home, if they need it, they can use it very effectively. Now the next one is about the injection.
Instructor Mrs. Torres, and these are two of her students, Jessica and Maria. I pass out with needles, so instead of being helpful, I'm going to let Mrs. Torres and her students show you injections.
So today the first injection we're going to be giving is an intradermal test, an ID.
So the first thing I'm going to do is clean the area. I'm going to pull the skin tight. I'm going to insert the needle at a 10-degree angle. I'm going to slowly push and administer the medication. And it's going to become a wheel.
Once she's administered her full amount of medication, she'll slowly take the needle out, put the safety on, and dispose of her needle.
This is basically, they have shown the subcutaneous type of medication, how we can use the subcutaneous, like under the skin, how we can give the medication. Intramuscular medication basically we take when we go for the vaccination. So our students are already aware about the intermuscular type of education, injection. So these are the different areas in the unit 1. Basically, as a teacher, we have to discuss with our student. And the next topic we have to discuss along with our student, who is the father of medicine. Basically, Hippocrates. Hippocrates was considered as the father of modern medicine based on his treatment on the observation of clinical signs and the rational conclusions. And when when was those medicines basically invented, and it was basically invented in the 2112 BCE to 2004 BC. But the first modern medicine was developed by 1804 by the Frederick Sertner, who was the German scientist. So we have to just to generate a curiosity among our students, who invented the medicine and how the medicine was invented. We can show one simple video to our student to just to create one awareness among them about the invention of the medicine.
The former begets knowledge, the latter, ignorance. Hippocrates. Hippocrates established the foundations of modern clinical medicine. He coined many terms that are now commonly used by doctors, such as symptom, diagnosis, therapy, trauma, and sepsis. Furthermore, he described a large number of diseases without resorting to superstition. Historians agree that Hippocrates was born on the Greek island of Kos around 460 BC and died in Larissa, Greece, at the age of around 95. According to Siranus, a physician and his first biographer, Hippocrates' father was Heraclides, a physician who, along with his own father, taught Hippocrates about medicine. Hippocrates' two sons, Thessalus and Draco, and his son-in-law, Polybus, were his students. Hippocrates is credited with being the first to believe that diseases were caused by natural causes rather than by superstition and gods. The disciples of Pythagoras credited Hippocrates with uniting philosophy and medicine. He separated medicine from religion, believing and arguing that disease was not a punishment meted out by the gods, but rather the result of environmental factors, diet and lifestyle choices. Hippocrates and his followers described many diseases and medical conditions. He's credited with being the first to describe finger clubbing, an important diagnostic sign in chronic lung disease, lung cancer, and cyanotic heart disease. As a result, clubbed fingers are also known as Hippocratic fingers. Although Hippocrates did not establish the school of medicine named after him, nor did he write the majority of treatises attributed to him, he is widely regarded as the father of medicine. His contributions revolutionized medical practice, and the Hippocratic Oath is in use even today. Hippocrates was so revered that his teachings were widely regarded as too great to be improved upon, and no significant advances in his methods were made for a long time. Hippocrates was known as the Great Hippocrates, according to Aristotle's testimony. Hippocrates was portrayed as a kind, dignified, old country doctor at first, and later as stern and forbidding. He was unquestionably wise, extremely intelligent, and especially practical. Thank you for watching. Don't hesitate to comment below.
So this is basically about the Hippocrates and his life, how he worked. So if we show these kind of great personalities, the video about these kind of great personalities who invented the medicine for the first time, our students will also be encouraged to invent something new thing, to discover something new thing, and the characteristic means of the Hippocrates means he was a very great person, he was very wise, he was very helpful, very kind, dignified doctor. So we can inbuild from their young mind when you will be doctor in future, you also have to possess these kind of good qualities in you, so that you can be helpful for our society. You can give a very good help for our society. Now the next one, in India. In India, who was the father of the Ayurvedic medicine? Because in our India, in the ancient time, basically allopathic medicine was not available. And Maharshi Charaka, he was one of the most important person who contributed to the Ayurved's ancient art of the science. So that, and the lifestyle system also. He basically, his renowned work, all the work was doing together, it was given in the Ayurvedic encyclopedia named as the Samhita Charak. So about the Samhita Charak, when the students will come to know also, so we can show them one small video about the Charak Samhita and how Charak has done his great work in our Indian society.
The Charak Samhita, also called Compendium of Charak, is a comprehensive Sanskrit text on ancient Indian medicines that was composed by Rishi Charak. Rishi Charak was believed to be a practitioner of the traditional system of Indian medicine called Ayurveda. It is considered to have flourished during the pre-2nd century CE. However, the studies on ancient Indian medicine indicate that the original text was written several centuries earlier by a legendary sage named Agnivesh, who was one of the 6 disciples of Ayurvedic scholar Punarvasu Atre. Each of the disciples went on to compose their own samhitas that integrated ideas from Atreya's school of thought, and in addition to that, they included their own understanding of the subject. Of those, Agnivesh Samhita specifically gave in-depth content that was later refined and annotated by Rishi Charak. Rishi Charak divided the treatise into 8 parts, namely Sutra, Nidan, Viman, Sarira, Indriya, Chikitsa, Kalp and Siddha. Each of these parts consists of multiple chapters, making it 8 books and 120 chapters in total. This ancient text gives in detail information related to ancient theories on human body, etiology, symptomatology, and therapeutics for a wide range of diseases. In Charak Samhita, Rishi Charak dealt elaborately with subjects like anatomy and malfunction of human body according to the 3 dosh, that is, the 3 fundamental bodily humors, Vata, Pitta and Kapha. Besides, it also included the sections on the importance of diet, hygiene, prevention, as well as the logic and philosophy behind the Indian medicinal system. It as well explains how teamwork between physician, nurse and patient is necessary for quick and proper recovery. Along with the Sushruta Samhita, Charak Samhita has contributed to Ayurveda as one of the 2 foundational ancient texts of this field that managed to survive. To watch more videos related
So
to physician,
basically, when
nurse,
about
and
the hypocrites we have talked about. After that, in our Indian medicine system, how Charak he has done his big means largest contribution in our Indian medicine system, especially in the Ayurveda. That also the students can know from these concept. Okay, you and your medicine concept in it, that is given in our unit 1. Importance of the medicine, what are the basic concepts of medicine, is what is medicine. So that is a substance that is required to treat for any kind of patient in any kind of disease, so that the person can get rid of the illness. It is the science or practice of caring for a patient, managing the diagnosis, prevention, because already we know that the prevention is better than cure. So prevention, how we can prevent the disease, how we can treat the disease, and of their injury, means whatever injury has been caused by the disease, and how to promote their health. So so that is basically the importance of the medicine. And one more very important thing in the medicine that is there, that is called the date of expiry. As the date of manufacture is important for any medicine, date of expiry is also very important for the medicine, because we all of us in all over the world, whenever we are going to take any medicine, obviously we should check for the expiry date, and we have to train our student in a way so that from their very young age they will be habituated in their life to check the expiry date of the medicine, and after that they should consume the medicine. And if suppose the student has to give the medicine to any of their household members, so parent or grandparent or anyone, so that time if the student will check the expiry date, and if the student will see that the expiry date is already over, the student can make the awareness in our society, because they are the young mind. We can train them in a way कि we can resolve many problems, because many people are not aware about the expiry date of the medicine. We know that yes, a large amount of money we spend to buy the medicine, even though the expiry date has gone, so we can consume no problem, because I kept it as it is, I didn't even touch it. But it is very dangerous. We have to train our students in a way that they can create the awareness in our society, so to check the expiry date of the medicine always. So in this way, expiry date of the medicine, what is the expiry date? Basically, till the date it is good to use to consume the medicine. That is the main thing. That date till which it is good to consume the medicine. If used after that, it may not be effective, or it may be life-threatening also. Anything can happen. Maybe the medicine will not be effective, or otherwise the medicine can be life-threatening also. So listed below are some ways by which we can identify the date of the medicine. Basically, it can be found printed on the carton bottle of the medicine, or the expiry date might follow like that. The example is given like that, EXP0323, that means the March 2023 is the expiry date. And in unit 2, now our unit 1 is already over. That unit 1 was basically about the you and your medicine. In unit 2, we're going to learn about, the students will basically, they will be aware about the different types of medicine that already we have discussed in our unit 1. And the main objective, they will be explaining the various types of medicine and their administration, how the medicine can be administered, and what is Ayurveda, Yoga, Naturopathy, Unani, Siddha, Homeopathy or Allopathy. What are the different types of medicine we are basically using in our society to get rid of different kinds of illness. So the learning outcome, basically as a teacher, we have to we have to make sure that our students will be able to explain about the various medicine available along with their treatment. That is our thing. As a teacher, we have to inbuild, and we have to make sure our student has to explain this. And how can we evaluate their knowledge? Their knowledge will be evaluated when they will be able to explain the forms of the medicine in the Ayurvedic, Ayush treatment, Unani treatment, Siddha treatment. They will have the proper knowledge on that. Performance evaluation, how you can evaluate as a teacher, how we can evaluate the performance. They have to identify various medicine. Okay, this one is the medicine belonging from the Ayurveda, this one is the medicine belongs from the Unani, this one is the medicine belongs from allopathic. So that's why they will they will be able to identify the various type of medicine. If they will be able to do that, that means their performance evaluation can be done by us as a teacher. Teaching and training method, obviously interactive lecture method, chalk and talk method, and basically what kind of activity we can do. The students have to identify and mention the types of medicine in the list of medicine prepared, because before in the unit 1, as a teacher we have given them to follow one project work, and that project work was based on the types of medicine the student has used in their home in last 1 year, and in which way the medicine was administered and what was the use of the medicine. So when they will they have to make the project work, they will talk to their parents, they will understand the system of the medicine that they have taken, and at the main time, at this time as a teacher we can help them to do that. So these are the different types of medicine. Already liquid medicine we have discussed about, and the tablets also. There are different tablets like soluble or the dispersible tablets are also there. Oral tablets are also there. Liquid we can take as a cough syrup, we can take the liquid. So these are the different types of medicine. Capsules are also there. And the next one, okay, the next one is the Unani. What is Unani? Unani is basically, that is the Perso-Arabic traditional medicine that is practiced in basically in the Muslim culture in the South Asia and modern day in the Central Asia also, and it is very, very effective. This term Unani, it is basically the Greek term, and Perso-Arabic system, the medicine was based on the technique, and it was basically given by Greek physician Hippocrates, who invented the medicine, and the Galen. And Unani system of medicine has its own origin. Basically, it is originated from the Greece. We will see one small video based on the Unani. Okay, what are the different types of Unani medicine and how we can use that? And it is also, Unani doctors are also called as Hakim. Basically, in our Indian old movie, if we see, sometime we can see it as the Hakim. That time the doctor in our ancient India, the doctors were called as Hakim. So who are doing the Unani treatment, basically, those doctors are called as Hakims.
The history of Unani system of medicine can be traced back to ancient Egypt and Babylon. Egyptians made use of medicinal plants as a remedy for ailments. They also initiated surgery as a method of treatment. The studies of papyri clearly show the ability of Egyptians in the field of medicine. Imhotep, 2800 BC, and Amenhotep, 1550 BC, were some noted physicians of ancient Egypt. Babylonians also played an important role in the history of Unani medicine. During Asclepian period, 1200 BC, the Greeks developed this art of medicine, drawing upon the medical knowledge of Egyptians and Babylonians. Hippocrates, 460 to 370 BC, freed medicine from the realm of superstition and magic, and gave it the status of science. He was a dominating figure in the classical period of Greek medical history. By searching the natural causes of diseases and recording the existing knowledge, he set the ground for medicine to develop it as a systematic science. A Roman scholar, Galen, 129 to 200 AD, stabilized the foundation of this science. Arab and Persian scholars and physicians like Rabban Tabari, 775 to 890 AD, Al-Razi, 865 to 925 AD, and Ibn Sina, 980–1037 AD, raised Unani system of medicine to the great heights.
So this is one basic of the Unani system of medicine. And another system of medicine, we can see the Ayurveda. Ayurveda, we all know, sometimes we use also, suppose when we are using the simple aloe vera at our home for our skin care, That is also one kind of Ayurvedic medicine. It is natural system of medicine originated in India more than 3000 years ago, and it is easily available at our home. And Sanskrit word basically Ayur means life and Veda means science or knowledge. So when we can implement the science or knowledge to save our life, that is called the Ayurveda. Ayurveda translates to the knowledge of life. And those who practice Ayurveda believe every person is made of the basic element of the universe. That is the space, air, fire, water and earth. So these five are the basic elements of the universe, and we all are made from these only: space, air, fire, water and earth. Now next one we have to see about the yoga and naturopathy. Yoga and naturopathy is completely based on the various drugless treatment like the acupuncture, acupressure, yoga and meditation, fasting therapy, diet and nutrition, mud therapy, hydrotherapy, exercise, and lots of the things are there. There we directly don't consume any medicine in our body. We do the external thing to get rid of the different kinds of diseases. Those are called as the yoga and naturopathy. So naturopathy is the form of the healthcare that combines the modern treatment with the traditional methods. Naturopathy basically focuses on the body's capacity to heal itself, preventing the health problems. And yoga helps to achieve a peaceful body and mind. And basically, if anybody is suffering from the stress or anxiety or the sleep apnea, the person cannot sleep at night in proper way, proper sleep is not happening the whole day, the too much anxiety is happening. So that time, to control our body and mind, to manage our stress, we can go through the yoga and naturopathy. Yoga asanas build the strength, flexibility and confidence level also. So it is not only useful for our student to implement, but the student can implement the yoga in their life also, so that they can increase their concentration level. They can concentrate more in their studies. They will be more focused in their life. Their body will be more flexible. They will get large amount of strength in their body. They can build a greater confidence level. So on that way, as a teacher, we can motivate our students to inbuild the yoga and naturopathy in their daily life. Next one, Siddha and Homeopathy. These are basically called as the Ayush. Ayush is the acronym of the Ayurveda basically. Yoga and Naturopathy, Unani, Siddha and Homeopathy. So that is the Sripad Nayak. He was the founder of the Ayush basically. Siddha system of the medicine is basically the ancient traditional medicine, and it is originated in South India. Basically, in the South India, the Siddha system was originated, and Siddha is one of the earliest traditional medicine system of the world, which treats not only the body but also our mind and soul. That is very important. All the time we should not think about our body. Sometimes our mind, our soul also needs some rest. Our mind, our soul also needs some some kind of relaxation, and that is very, very important, because when our mind is in good state, our body will also be in the good state. Now the Siddha and Homeopathy, apart from government and private medical college, Tamil Nadu and Kerala, basically the Siddha medicine is also taught in 2 universities of Sri Lanka also. In India, basically Tamil Nadu and Kerala, the Siddha medicines means the study is going on. In Sri Lanka also 2 universities are there who are giving. And the word homeopath, that is basically derived from the Greek word homeos. Homeos means similar, pathos means suffering. So homeopathy, the main concept of the homeopathy is like that. It is a homeopathy natural diseases are treated with the substances that produce the effect similar to the suffering. If the suffering are similar, we can use same kind of medication to get rid of the suffering. So homeopathic remedies are also used by the public for viral diseases, different forms of allergic conditions, skin disorder, behavioral problem. If we are not feeling well, if we are getting some itchiness, skin disorder, allergic reaction, automatically there will be some changes in our behavior also. some chronic, it can be converted in the severe chronic long-term disease also. So homeopathic remedies basically use those kind of diseases. From the origin of the disease is one, but the symptoms can be many. So we can use the homeopathy to treat many types of symptoms, but we have to cure the main origin of the disease. That is very important. And modern medicine, when allopathy we are using basically whatever the symptom is, like if we are getting cough, for cough we are taking the medicine. If we are getting fever, we are getting that medicine for, we are taking the medicine for fever. So different field. If it is infectious disease, if it is emergency, if it is bacterial disease, so different types of medicine we are basically using for in case of the allopathy. And the revolution, it was a greatest revolution, and that is the life-saving method. Allopathy is basically the lifesaver. 18th century it came, but it has become the lifesaver. In third unit, basically we are going to learn about the the different where do medicines come from. In the first video we already have seen that how the R&D is done, how the medicine can be manufactured. So various phases, total 3 phases are there: first phase, second phase, and third phase. So how the medicine was discovered. So all these things already we have discussed. One quick explanation we will go through it because it is given in our unit 3 of this concept. Learning outcome, the students will be able to explain how the medicine was invented. That already we have seen that in case of Hippocrates, and in our Indian Ayurveda system what Charak has done. So that video we can use to teach our unit 3 also. And how we can evaluate the knowledge of the student. The student should be able to explain the cause to create the medicine. Why the medicine is important, what is the importance of the medicine, why the medicine is needed. So that cause, they have to know that is their knowledge, they have to gain that knowledge. And what are the procedures that take place before medicine come in the market, what are the different phases the manufacturer of the medicine has to go through. Performance evaluation we can do to we can see just to identify the steps, how much time it takes for a medicine to come in the market. They have to do the research. Okay, in a simple market research, suppose when COVID-19 came, Manoranjani ma'am will discuss about that. It is there in our last unit 6. So what are the different phases, what are the different trial phases went when we have generated the Covaxin. So what are the different phases that we have after 3 phases of the clinical testing. We told that yes, now the Covaxin is safe to use. Then only the Covaxin came to the market, and all means maximum people we have taken the COVID vaccination. So any kind of vaccine before coming to the market, what are the different stages it has to gone through. That is the performance evaluation. We can go through it by the interactive and talk method, and the activity we can do when the student will know about the medicine, why and when it was created. They have to search a bit more. Okay, and they have to search that. I was discussing about that only. Different kinds of diseases they can choose, like the COVID is one disease, mumps, measles is another kind of disease, pneumonia is another kind of disease. So any kind of disease they can choose, and they will do some research work, and they have to find out how the medicine came in the safely in our society, and how when we are using the drug, how much safe it is used to. What is the drug development method? Drug development is basically done by the discovery and development. After that, the pre-clinical research. Third will be the clinical development. After the pre-clinical research, we will clinically develop the drug. Then the FDA review will come automatically. In that video also we have seen, till the time FDA will not give the report key, yes, the drug is safe to use, the drug will never came to our chemist shop. And after that, the post-marketing monitoring. So when a good drug has come to our society, all the people should know about the drug. That is also important. It should reach up to our hand. He has a good drug. So post-marketing monitoring is also important in this field. And where do the medicines basically come from? There are total 3 phases are there. first phase 20 to 80 participants can take place. In this phase, basically the researchers test the new medicine on the volunteer who is healthy. That is basically based on the volunteer. Means they that time who want to get the drug in their body, only those people will take those. We will not force anyone to take the drug. It is only done, it will be, the first phase will be done only 20 to 80 participants, and those 20 to 80 participants will be the basically the volunteer. And when it will be passed, then the aim of the phase is to be to test the safety of the new medicine. And after that, okay, the drug is safe to use. When we will make sure, then the 100 to 300 participants we will take in the second phase. And in this phase, 100 to 300 people, when the doctor under the doctor supervision, when it will be done, then we will go to the third phase. And in the third phase, 1000 to 3000 participants will come. And in this phase, we can get the idea about the side effects also over the time by the new treatment. So when the doctors will say and the researchers will say, the scientists will say after the third phase, no, it is completely safe to use the drug, then the drug will come to our society and easily it will be available to our hand, so that we all can get the, and post obviously after that the post marketing that advertising and advertisement will be done. The doctors will start prescribing the drug so that it will be in the reach of everybody and we all can get it very nicely. Now the different phases, and now I will hand over it to Manoranjani ma'am because unit 4 ma'am. Yes ma'am.
Okay, thank you ma'am. Thank you so much.
Yes ma'am.
Now help me in showing the slides ma'am. Piyali ma'am. Okay, thank you. So now we are dealing with vaccination and vaccine. What is the importance of vaccine? And here the main objective of this unit is children must be getting an awareness on the concept vaccine and its invention. Then surely they'll be able to explain about it. So that is one of the main objective. They get an awareness. Usually we all know that when we get when we come to know about vaccination, we all get upset. It is painful. And here, even though it is painful, and why we are having vaccination. So they are getting an awareness on this after studying this particular unit. And discuss about the various type of vaccination. The children, surely they will be able to explain about the types of vaccination and surely the use of vaccination. Here the children will be able to explain about the use of vaccination after studying this particular unit. Next slide, ma'am. Okay, now here we learn about what is the learning outcome. After studying this particular unit, what will be the learning outcome? Learning outcome surely is the awareness, and surely they will be able to communicate on this and explain about vaccination and its usage. That is a learning outcome which is very important. We teachers, we need to look at the learning outcome, whether it is achieved or not after the test or assessment. And we will be able to understand whether the children, they got an awareness on this and they are able to explain on this. What is vaccination and what are the different kinds of vaccination and the usage. And knowledge evaluation. So knowledge evaluation explain the role of vaccine and its invention and type. Here the children, they are able to explain about the different role of vaccination and different types of vaccination and the invention of vaccination. So they must be able to explain about it. And then performance evaluation, identify. So we need to assess them. So what kind of performance evaluation we can give? Actually, it is an assessment now. So identify various vaccines for various diseases. The children, after studying this lesson, and they surely must be able to identify the different kinds of vaccination for different kinds of diseases. And that is the assessment which we are supposed to give. And the methodology is, and as usual, and the blackboard and teaching method, and even with that, we will be able to give them a chance to visit a particular pharmaceutical company where they are making the vaccination. So they will be surely able to explain to them and which are the diseases we are having vaccination, why, and we are using it, and those kind of visit to a pharmaceutical company may be one of the methodology which we can have, and even discussion in the classroom about the types of vaccines and which are the diseases for which we are using the vaccination. The discussion in the class will be helpful for the children to understand in a better way. And then book activity also, we will be able to give the vaccines against the diseases they can prevent or cure. So they can read books, and they can discuss, and they can write the points, and these are the activities we'll be able to help the children to understand. As teachers, we can give it to the class. Next slide, ma'am. So when we hear the word vaccine and we get fear, so it is very scary word actually. And then here we help them to understand such a very difficult, painful medication, who invented it, and we ask the children to find it out, and they can think why, even though it is painful, why it is important. So who invented it and such things, and it is the duty of the teachers to help them understand. It was Edward Jenner who invented vaccination, and that is also in the year 1796, years back. So that also will help them to understand the importance. And the first vaccination was against the smallpox. It has been developed, but it was during that time it was spreading everywhere. So the vaccination has been invented to this particular disease, that is smallpox. Why it is important to get vaccinated? So the children, and they need to read, and they need to understand, and they can have a discussion again in the class. It is a safe way to build our immune system. So that awareness the children need to have. Vaccinations are known to be boost your immune system by teaching your body how to fight threats. So they must understand that fighting threat, and we have lot of threats in our body, and then this vaccination, how it helps us to have better immune system. So that kind of understanding is important. So we need to help them to understand that. Many consider vaccination as the way to build up your immune system. It protects you from many serious or potential deadly diseases, help stop diseases spreading to people. So vaccination is helping spreading diseases, and it helps us to manage our immune system, and this way we help the children to understand about it. So there can be a discussion or even any kind of activity teachers can take up. So the children, they can explain about their experience of vaccination and what benefit they got after vaccination. So that also can be explained. Children, they can explain about their own experience also. That will surely help them to understand about this importance of vaccination. Ma'am, next slide. Experiential sharing is one way. So please watch the video. Ma'am, there is no sound. Can you please unmute? Ma'am, it is muted.
Please. Called smallpox spread among people, causing boils filled with yellow pus to appear all over their bodies. Some people also went blind, and many died. Those who survived the disease were usually left with deep scars. In England in the 18th century, there was a huge outbreak of this horrible disease. But a cattle breeder named Benjamin Jesty observed that a mild disease affecting his cows, called cowpox, looked very similar to the deadly and...
I think in YouTube channel it's not showing. Just for a minute, I will just go...
Okay.
Uh,
Yeah, it is showing better way, ma'am.
it is showing, ma'am, but I think
Yeah, it is showing now. Yeah, yeah.
it's showing now, ma'am.
Yeah, yeah.
Okay.
Continue.
For centuries, a deadly disease called smallpox spread among people, causing boils filled with yellow pus to appear all over their bodies. Some people also went blind, and many died. Those who survived the disease were usually left with deep scars. In England in the 18th century, there was a huge outbreak of this horrible disease. But a cattle breeder...
Yeah, it is visible, ma'am. It is visible. You can continue.
In YouTube channel, it is not visible, ma'am. I don't know why. In YouTube channel where it is going on, here we can see the comment there. It is not showing, ma'am. Just a minute.
Piali ma'am, it is little fluctuating. Maybe there is little some network issue from our side or from at your end. It could be.
Okay. Should I make it one more time? Should I check it? It is working or not? Yes, ma'am.
For centuries, a deadly disease called smallpox spread among people, causing boils filled with yellow pus to appear all over their bodies. Some people also went blind, and many died. Those who survived the disease were usually left with deep scars. In England in the 18th century, there was a huge outbreak of this horrible disease. But a cattle breeder named Benjamin Jesty observed that a mild disease affecting his cows, called cowpox, looked very similar to the deadly and contagious smallpox.
Yes, ma'am.
He noticed that cowpox could also affect humans, but in a less severe way than smallpox. The interesting thing was that he himself and the milkmaids who had previously been infected with cowpox never got the horrible smallpox. Somehow, the cowpox infection protected them. This observation inspired Jesty to try and protect his family in the same way. He infected them all with cowpox, and it worked. None of them ever developed smallpox. A few years later, a doctor named Edward Jenner built on Jesty's discovery. He wanted to prove the theory that getting cowpox could protect a person from smallpox. So, he took a bit of pus from a cowpox blister on an infected milkmaid and put it into a cut in the arm of a young boy. When Jenner exposed the boy a few days later to the smallpox virus, he did not develop the disease. Just like Jesty and the milkmaids, his body had learned how to fight the disease. We say he became...
Manoranjani ma'am, just now I shared the video with you in WhatsApp. So you please try to do from there. Maybe it will be visible now.
Okay. Now also it's not visible there in YouTube?
No, ma'am. In YouTube it is not visible.
Okay.
It's completely blank screen is going on. Actually, white screen is not going on. So in YouTube channel. So, ma'am, I shared the video with you. You shared.
Yeah. I'll try. Anyway, I think it is coming only. I will, ma'am, you can show the other slide, and at the end of this session, and I can show that particular video.
Okay, ma'am. No,
you can the PPT.
Okay.
What I think, Manoranjani ma'am, Piali ma'am, we should take a 10 minutes little break for a tea. Might be our internet issue can resolve.
Okay, ma'am. Ma'am, should I share the video with you from your side? Can you show, or what should I do?
Yeah, I can share it and you share
Okay.
and it is, yeah.
Okay.
Okay.
Okay,
So
then
now or after this particular session, ma'am, 10 minutes.
It's all up to you, ma'am. If you wish to, we can continue. If you allow us, we can take a break.
I think after the only 2 more sessions,
Slides
units
are
are there.
there.
So we can finish it up and then we can go for the 10 minutes break.
Sure.
Okay. Okay, then I am sharing my screen, ma'am.
Yeah. Okay.
For centuries.
Next slide, ma'am.
But I don't think, just a minute, ma'am, just wait a minute. I think YouTube it is coming.
Oh, okay.
Is my screen visible now?
Yeah. Your screen is visible now.
Video we will show it afterwards. Means many participants they are concerned about the video. No problem. We will show the video afterwards. As soon as the technical glitch will be over, we are going to show the video once again.
Yes, ma'am.
So,
Yes.
Jyoti ma'am, can you please check once so that my screen is visible to all of them or not? Just once. Is my screen
visible now?
Okay.
Okay, so we will show the video. So the participants need not worry about the video. We will show it at the end of these slides. So now we'll talk about types of vaccination. So the whole virus vaccines use a weakened or deactivated form of pathogen, or it's a bacterium, virus, or other microorganism that can cause disease. That causes disease to trigger protective immunity to it. So vaccination help us to control the virus and which is moving in our body. Now next is subunit. Protein subunit vaccine consists of small pieces of protein and a carbohydrate, for example starch, cellulose or glycan from pathogen, which has been carefully studied as to which combination of the molecules would produce a strong and effective immune system. So protein subunit help us to be strong. By having this vaccination, we'll get more of starch, glycogen, and even it is helping us to be strong, and we can prevent ourselves from all kind of these infectious disease or even virus. So that is actually protein subunit, and we are injecting the protein to the body and which help us to be strong. And whole virus, when we are getting a disease and we are treating against the virus. So these two kinds of vaccinations are available. After getting a disease, there is a vaccination, and just to protect ourselves, and there is another vaccination. Next slide, ma'am. Then the third one is viral vector. Viral vector vaccines use a modified version of a virus that is different from the virus being targeted to deliver important instructions to our cells. That is viral vector, and which is helping us to protect our cells, and this will again help us to control when it becomes viral. And next one, fourth one is nucleic acid, that is RNA and DNA. This is a relatively new technology, very new technology, where nucleic acid vaccines use actually genetic material from a disease-causing virus or bacterium to stimulate an immune response against it. So it is actually protecting us from the beginning itself, and to stimulate an immune response against the diseases. And that is the fourth one. Next slide, ma'am. Okay, so we saw that there are 4 kinds of vaccinations which are available, and one is after getting the infection, one is protecting it, one is even from the beginning itself we can protect the body before when we become the disease become viral. So such a way these vaccinations are available, so the children can find out which are the kinds of vaccination, why we use it. We can have a discussion also in the class, so we can have a example also, so they can think about which are the vaccinations such a way, in a better way, from their own experience, and also from a discussion in the class, and that will help the children to understand better about the vaccination, kinds of vaccination for which diseases we are using the vaccination discussion, and from own experience they can explain. So now how a vaccine works. And here I think unit 5, shall we start it after break, ma'am?
Yes.
Okay,
Sure,
ma'am.
So, thank you, Pyali ma'am and Manoranjani ma'am. You both were speaking for too long. You must have some tea or water. And to all the participants, we all will meet after 10 minutes short break. It's 11:45 now. We will meet again at 11:55.
Okay.
Okay.
Okay. Thank you, ma'am.
Shall we continue, ma'am?
Yes, ma'am.
Yes, Manoranjani ma'am, we should continue now.
Okay, so I think I can show, I arranged this presentation, and that particular presentation we can start with.
Okay, ma'am. Yes, ma'am.
Okay, so we are here just to show you one video, and which is talking about starting of immunization and vaccination. Sorry, not immunization, vaccination. So the background at which and we started inventing this vaccine. Okay, please watch this particular video. I don't know, it's not playing.
Ma'am, you just click on the play button, ma'am.
Yeah, I did it, but again it was showing. Okay, once again we'll try.
Ma'am, down that round one, that play button you click, ma'am. Big one. Big triangle is there, na? Big triangle, yes, ma'am. Left, that big triangle, yes, ma'am. That one, yes. Left side. Yes, that one, yes. That one you click.
It's not getting on.
Okay, ma'am, no problem. This button only. You click this button. I think it will play. Okay, ma'am, no problem. I will share. I think now I stopped it now, so it will work now.
Okay.
Is my screen visible?
Yeah, screen is visible.
So that vaccine video we will start. Video.
Vaccine video.
For centuries, a deadly disease called smallpox spread among people, causing boils filled with yellow pus to appear all over their bodies. Some people also went blind, and many died. Those who survived the disease were usually left with deep scars. In England in the 18th century, there was a huge outbreak of this horrible disease. But a cattle breeder named Benjamin Jesty observed that a mild disease affecting his cows, called cowpox, looked very similar to the deadly and contagious smallpox. He noticed that cowpox could also affect humans, but in a less severe way than smallpox. The interesting thing was that he himself and the milkmaids who had previously been infected with cowpox never got the horrible smallpox. Somehow, the cowpox infection protected them. This observation inspired Jesty to try and protect his family in the same way. He infected them all with cowpox, and it worked. None of them ever developed smallpox. A few years later, a doctor named Edward Jenner built on Jesty's discovery. He wanted to prove the theory that getting cowpox could protect a person from smallpox. So, he took a bit of pus from a cowpox blister on an infected milkmaid and put it into a cut in the arm of a young boy. When Jenner exposed the boy a few days later to the smallpox virus, he did not develop the disease. Just like Jesty and the milkmaids, his body had learned how to fight the disease. We say he became immune to the disease. This was a crucial step in the development of vaccination. In fact, the word vaccination, thought up by Jenner, comes from the Latin word for cow, vacca. Following Jenner's experiment, smallpox vaccines began to be produced in large quantities. Millions of people got vaccinated in every corner of the world, until in 1980, the World Health Organization announced that smallpox had been eradicated. Today, we no longer need to use the smallpox vaccine, as the virus is no longer circulating. This story serves as an example of how vaccines can help in the fight against infectious diseases. Thanks to Jenna's discovery, we got rid of smallpox and are now continuing our work to eradicate other infectious diseases such as polio. This story serves as...
Okay, so this one is done.
Okay.
Yeah. So now after that, ma'am, you have completed up to this one, na? Like how does the vaccine works? So there also one more video is there. So I think it will be helpful for the students if they will see this video.
Yes.
How does a vaccine work? What are the elements of our body that are implemented during a vaccination? When a pathogen, a virus or bacterium is introduced into the body, it multiplies and attacks cells. This is known as an infection. Recognizing this microbe as a foreign body, the immune system develops two defense strategies using various types of white blood cells. First of all is the innate immune response. Macrophages are at the heart of this. These killer cells swallow up intruders, whatever they are, to destroy them. Phagocytes capture and eliminate toxins. This rapid and localized reaction can stop or slow down the infection. But that's not always enough, and that's where lymphocytes come in. They're defender cells which can identify the invader thanks to its characteristic molecule, the antigen. Each lymphocyte is adapted to attack a particular virus or bacteria. As soon as it identifies the antigen, the lymphocyte multiplies. B lymphocytes have the capacity to produce vast number of antibodies. Circulating around the body, antibodies latch on to these antigens and neutralize them, allowing macrophages to eliminate them. T lymphocytes identify and destroy infected cells. The problem is that on first contact with an antigen, the immune reaction is slow, taking several days, giving germs time to unleash an illness. Fortunately, the body remembers its enemies. Following an infection, antibodies and lymphocytes are left with a memory. They therefore react if the same pathogen reappears. The immune reaction is much faster, and the body eliminates the attacker before the illness develops. Vaccines work by exploiting the immune system's memory. Vaccination simulates an infection, training the immune system and enabling it to develop weapons to fight back. This is done by introducing a germ which is dead or inactive, or just a fragment of the germ into the body. The vaccine triggers an immune reaction without causing the illness. The organism produces lymphocytes which memorize the invader and antibodies in preparation for any future attack. The power of these antibodies and lymphocytes tends to diminish over time, which means top-up vaccinations are sometimes necessary.
Yes, ma'am.
Okay, thank you, ma'am. So now here with this video, you might have understood that how a vaccine works and what is immunization. That is very important. Next slide, ma'am.
Yes, ma'am. This one is done, na?
Yeah. Okay, this one only. Okay, so yes, ma'am. So immunization. Here, the children, they need to understand what is immunization, and then again the process of immunization. We are showing that same video only here, and then again they are learning about immunization card. I think this card is very important because we all come to know about this card very seriously when we got the COVID. I think while when we were having the COVID and we were able to travel only with the card, because vaccination card is there and we get a surety that we got the vaccination so we can travel. So we won't get the disease again. So that is the importance of immunization card. Even the children in their smaller age and they are getting the card and the immunization vaccination they are getting against measles, jaundice, etc. So the card is very important. Why? Because the public they have an understanding that and we got the vaccination and our body is having immunizations to beat something. So that is the purpose of the immunization card. So here with this, how a vaccine works, with that the children they are able to explain about immunization. They understand. They get an awareness about immunization. So they are able to explain the role of vaccination. These are important. Now, are vaccination and immunization are the same? Vaccination is the term used for getting a vaccine, that is actually getting the injection or taking an oral vaccine dose. Immunization refers to the process of both getting the vaccine and becoming immune to the disease following vaccination. So vaccination is the process actually, and we are getting the injection or the oral dose. Immunization, and it is actually immune to the disease, getting the vaccination. So that is the only difference. This is very important. The children need to have an understanding on this. So we need to help them to differentiate between these two. The children can do better I think, by giving the idea. Now next slide. Process of immunization. Immunization is a process whereby a person is made immune to an infectious disease, typically by giving him the correct vaccine. So, to become immune to a particular disease by getting the correct vaccination, that is very important. The children must know about the seriousness of getting that vaccine when we need to protect about a particular disease. So the disease is important. The vaccine for each disease is different. So that understanding should be there with the children. So active immunization and passive immunization. There are two differences of immunization. Active immunization is body generates its own responses to protect against infection through specialized cells. Antibodies are stimulated by vaccines. So we all know that by getting the vaccination, so the body react. So the body get antibodies to react against a particular disease. Passive immunization, that is called active immunization. Passive immunization, it is ready-made antibodies are passed directly to the persons being immunized. Directly, and we are giving these antibodies to the body. That is passive immunization. So these two differences also the children must be able to understand and identify. Vaccines use dead or severely weakened virus to trick our body into thinking we have already had the disease. So that is, vaccine use the dead or severely weakened virus to the body, and where the body realize that I am immune to this particular disease. When you get a vaccine, your immune system responded to these weakened invaders and create antibodies to protect you against future. So how the body take a precautions when they are getting the vaccine? The body and produce the antibiotics. So antibodies. So they protect against the future infection. So that is the advantage of active immunization. Through the vaccine, the body reacts. So the body produces antibodies. So that is one thing. And other one is, we already have seen passive immunization is directly we are giving the antibodies to the body. So these differences the children must understand by discussion or even by any kind of activities. Next slide, ma'am. Okay. So this card is important. I was talking about the immunization card. So I think with the COVID, everyone has come to know about the importance of the card. Vaccination records, it is called the records, provide history of all the vaccines you have received. So this card record may be required to certain jobs, travel abroad or school registration. This card is important for getting a job, even mainly for traveling and also school registration. This card is important. I think all the schools are having the health card. There you can record about the vaccines which they got, or vaccination record also can be there in the health card. So this vaccination card is different, but you can have a record in the health card also. Or you can keep a separate vaccination card, which is very important for children, not only for children, every one of us, especially pandemic situation. So next slide, ma'am. And we have witnessed a situation that is COVID-19, a global pandemic situation we all witnessed. Earlier we heard about the pandemics, like smallpox and other kind of cholera. These we heard it has happened fast, but we this age we actually witnessed what is a virus and which is causing a problem for everyone. So global pandemic COVID-19, here the chapter is talking about COVID-19. So they learn about corona, even though we experience, but most of them they may not be knowing and what is corona and types of vaccines available for corona, important helpline numbers. The children must aware about all these facts. They must aware about the vaccine. They must aware about the vaccines available for corona and helpline numbers and which we can use during the pandemic. Next slide, ma'am. So in the same chapter, they are learning about, here we are supposed to test whether the children they got exact understanding about COVID-19. So the learning outcome should be the children must be able to explain about it. They must, that's why we need to create an awareness among the children to understand about COVID-19 as an important pandemic. And then how can we evaluate the role of vaccination, hygiene during pandemic? So COVID-19, we always were discussing about washing hands and even taking bath, and which is very important. So we can have evaluation regarding how much they are aware about the neatness, the cleanliness, and the role of vaccination during the pandemic COVID-19. And then they will be getting the knowledge and performance, importance of hygiene, maintaining social distancing in crowded area and hospitals. And we can talk about the mask also, where the children, they themselves, they will tell us about this. So I think first of all, we need to ask the children to explain about the hygiene, how we can prevent COVID-19. Surely they will tell us that social distancing and which we experienced, and then hospitalization at certain cases, and even wearing mask and importance of hygiene. These surely the children will discuss. So give a chance for the children to share their experience and discuss in the class. And teaching method is interactive method, where the discussion is very, very important. Experience sharing is also important. So they can talk about, they can list down what are the do's and don'ts during the coronavirus time. Easily they will be talking about that, and the teachers can add to it. Next slide, ma'am. So coronavirus, most common symptoms, fever, cough, tiredness, loss of taste or smell. That was the main important symptom of coronavirus. When somebody was not having the taste and smell, surely we check during that time. We were checking that. And even fever and tiredness, that is another symptom of virus. And less common symptom, sore throat, headache and pain, diarrhea, a rash of skin, or a discoloration of fingers or toes, red or irritated eyes. And that I think less common symptom. Certain people, they were having this symptom. So diarrhea, always we can say that it is COVID. But fever, cough, tiredness, taste, loss of taste and smell, surely that is the most common symptoms. Less common symptom, this headache, diarrhea, discoloration of fingers and irritated eyes, and these were the less common symptoms. Serious symptoms were differently difficulty in breathing or shortness of breath, loss of speech or mobility, or confusion, chest pain. So this was the serious symptom when the patient was having breathing difficulty and loss of speech and they can't move and confusion, and there is in the chest heaviness, and surely we need to take the patient to the hospital. That is very serious symptoms. So the symptoms are of 3 types. The children must be able to understand about it, and the most common symptom and less common symptom and serious symptoms. That is important. Now, next is naming of coronavirus. Coronavirus was previously known as 2019 novel coronavirus. Now it is officially named as disease, coronavirus disease COVID-19. So virus, severely acute respiratory syndrome virus 2. So that is actually the whole name of the virus is SARS-CoV-2 severe acute respiratory syndrome coronavirus 2. So that is the name of the virus. Now I think that the
video is there.
Yeah. Please watch the video. So you need not worry about the video. We can share the link.
Like many viruses, it uses a protein on its surface to attach to and enter our cells. Antibodies that fit onto this protein can block the virus from attaching. Coronavirus mRNA vaccines teach our immune system to make these antibodies. How do mRNA vaccines do that? mRNA is a genetic material that instructs our cells to produce proteins. The mRNA in the vaccine is wrapped in a layer of fat particles that protect it and help it get taken up by specialized cells of the immune system called dendritic cells. Once inside these cells, the mRNA does not enter the cell's nucleus or interact with DNA, but remains in the cytoplasm with other mRNA molecules, waiting to create the enzymes our body needs. When ribosomes read the vaccine mRNA, pieces of the viral surface protein are made. These pieces are then displayed on the surface of the dendritic cell. The dendritic cell travels to a nearby lymph node, where it presents the surface proteins to other cells of the immune system. Some of these cells, called helper T cells, train B cells how to make antibodies that will fit perfectly onto the surface protein of the virus. Other cells stimulated by the protein pieces, called cytotoxic T cells, can kill virus-infected cells. Now, when the coronavirus tries to infect us, our immune system is ready, immediately recognizing it, neutralizing it, and destroying it before we ever even have a chance to become sick.
Okay, so in this particular chapter, and the children surely will be getting an understanding regarding COVID-19. So there are helpline. Arogya Sedu app is there. Children must know about Arogya Sedu app, and the vaccination card is also important. So let them go through the Arogya Sedu app, so they will be getting better idea regarding and what are the precautions have been taken by the government of India to control the COVID-19. So what are the precautions we are supposed to take up? So this chapter is maybe quite interesting for the children since they experienced it. Okay, this is all about this particular chapter. Thank you.
Yes, ma'am. So now we can start with our next one.
I think we can continue till 12:30, ma'am. Jyoti ma'am.
I think 1:30, na? Or what? Jyoti ma'am will.
Yeah. Yes. We can finish next. This.
Yes, ma'am. So things you should know about keeping medicines at home. That is subject code 915. Now, right now we can start with that lesson. That chapter. Ma'am, is my screen visible now?
Yes, it's visible.
Okay. So now we are going to start with the new one. That is the code number is 915, and it is the things you should know about keeping medicines at home. That is another subject basically with another subject code. And in this concept, basically we are going to learn about the different units we are going to learn about, and it is basically let's shop. That means when the medicine is already invented, so how to shop the medicine, how to get the medicine, where is my medicine? This chapter is basically, this unit is basically telling about that only. That is the learning outcome will be the students will know about the places from where the medicine can be shopped for. We can shop the medicine from the medicine shop. We can shop the medicine from the online cart. We can shop the medicine from any other source, like any suppose somebody is going to shop for any other thing, we can request that person that can you please buy some medicine for me, as I am sick, I can't go to the medicine shop right now. So that means what is the different places or a different market shopping mall from where we are buying the medicine, where we are getting the medicine. The knowledge evaluation, the students will be able to explain about the prescription, how to write the prescription, what are the different parts of the prescription, and what are the different options to buy the medicine. The student, that is the basic knowledge as a teacher we have to implement in our student. Next one, that is the performance evaluation. Will evaluate the students will be evaluated based on the performance. What performance? They will be able to describe the various places from where we can get the medicine, so that if we ask our student in their small young age only, they will be able to tell from where easily the medicines can be available. Different teaching and training method, obviously interactive lecture method, chalk and talk method, and the activity method is name the place from where the medicines can be purchased. So we can play the quiz also inside the classroom, or we can do some role play also inside the classroom. Suppose one will be the shopkeeper, another student can be the buyer or the seller. So like that we can create one situation where one student will come and ask for one medicine, so that the student who is the seller, the medicine seller, that student can tell, please show me your prescription. Without prescription we can't give you the medicine. So that the students will be aware, yes, over the counter medicine we can buy, but not all kind of medicine. We need the prescription, so we have to go to doctor to get the prescription. So it is in our society that awareness is very, very much needed. Because whenever we are getting any small problem, simple fever or simple cough and cold, basically we go to we are having the habit. Basically we go to the medicine shop and we ask for the medicine, so that we need not to pay the doctor's fees. Okay, means many people are having that habit ki we need not to go to doctor, simple we can go to any medicine shop, we will ask for the medicine, the shop people will give us the medicine and we will consume. But sometimes it can be very, very harmful. As a teacher, we have to create the awareness among our students, so that our students will stop their family members also to go to the medicine shop to buy the medicine. Always first we should consult with the doctor, that is mandatory. Because one medicine can ruin our whole life. One medicine can harm our whole liver. One medicine can harm our kidneys. The vital organs of our body can be damaged due to the administration of one wrong medicine. That is very dangerous. So that awareness in this age, in the young mind, as a teacher, we have to incorporate. So this is the basic thing of the skill subject. We can make our society in a way in the future, so that everybody, no one will be in trouble. Now the next one, objective of the course will be to discuss the need for the purchase of medicine. Why the medicine is important? Why the purchase of medicine is important? The sympathy. If anyone is very much ill or sick at our home, other person should run to the doctor. We should call the doctor at home, and we have to purchase the medicine so that we can give some comfort to our loved ones, okay, at our home. Introduction to prescription and over-the-counter medicine. Our students will be able to identify which medicines are the over-the-counter medicine, which medicines are the prescription medicine. So we can play one quiz type game or role play type game. So this is the over-the-counter medicine. Yes, you are allowed to take it from the shop. But if it is the like prescription medicine, obviously you have to visit to doctor to get the proper prescription, and then only the medicine will be given to you. Next one, the students will be able to explain about the various options available to buy the medicine also. So these are the one video I want to share with all of you. Here we can see what are the different types, how means what is the importance of purchasing the medicine.
An introduction to medication safety, brought to you by World Patients Alliance, www.worldpatientsalliance.org. Do you take medications? Almost everybody does. But what do you know about medication safety? We all need medications sometimes, but medications are powerful agents that need to be used with care. Did you know? Medical error is one of the leading causes of death and disability in the world. About half the harm from medical error is caused by mistakes with medication. At any given time, about every 10th person in the hospital is there because of harm from medications. Medication use has increased by about 1/3 over the past decade. As the number of medications goes up, so does the risk of harm. Not all harm from medications can be avoided. That is why it is important to take only the medications you need in the amount you need and no more. What can you do to take medications safely? Know what each medication is for and how long you should take it. Know the potential side effects. Be careful of over-the-counter medications. They can have serious side effects just like other medications. Take the smallest dose you need. Keep a list of your medications. Review your medications regularly with your provider. Do you still need them all? Are they all safe to take together? Report side effects to your prescriber or to your National Center for Reporting Adverse Drug Events. To learn more, visit the World Health Organization or visit World Patients Alliance, www.worldpatientsalliance.org. The global voice of patients.
So in this video, we have basically seen how what is the basic need for the medication safety, because medication safety, that awareness right now in our society is very much needed. Medication safety means it's like that suppose doctor has prescribed us one medicine. When we are going to the shop to buy that medicine, maybe that specific medicine is not available in the medicine shop. What basically the shopkeeper they do, the shopkeepers they tell us this medicine is not available with us with the same generic name, or with the same thing we want to provide you the another medicine. So that is available in our shop, but we have to recheck that medicine with our doctor. We should consult with our doctor one more time. Doctor, this medicine what you prescribed to us, those medicine is not available in the shop. Should I take this medicine? Because sometimes the composition will be different. But just to sell out the medicine, if the shopkeeper will tell us to take the medicine blindly, we should not believe on them. We should not take the wrong medicine and we should not consume that. That awareness always we should incorporate in our student, so that they can make the awareness in our society and we can save many lives in these ways. So let's shop from where is my medicine. The next topic is about the medicine that is the relief of the pain. If anybody is suffering from the pain, or suppose if the pain medication sometime means if we see in our home also someone is suffering from pain very badly, so and we also don't feel good at that time, and then and there we run to the medicine shop to get the medicine. So we have to be very careful whenever we are taking the pain relief medicine also, and always we should consume the pain relief medicine along with any kind of antacid tablet, because whenever we are taking the pain relief medicine, automatically it will increase the acid secretion in our stomach. So by the time any one kind of handy antacid we should take before consuming the pain relief medicine, so that the acid balance of our body will be maintained in proper way. So it will promote the health and we can see that if the child is sick, or he or she can get the medicine, so after some time the child will become very much happy, and then we will also feel very good, and it will prevent the different kinds of diseases. Sometimes some preventive medications are also like that. They are like the anti-flu. On the means when the flu seasons are coming, before that, just now Manoranjani ma'am has discussed about the vaccination and immunization program also. So like the anti-flu vaccines are also available. Sometimes we can take that, so that on that same season we will not get any disease, any flu we will not get. So anti-flu is basically, it is told that below the age of 5 and after the age of 60, that means basically the children and the old age people whose immune system is not that much strong. It is not at all necessary for the adult basically, but the small children and for the older people basically whose immune system is quite suppressed. So in those kind of cases we can give the this kind of preventive measure for those kind of people. So now the next one more video is there. I want to share it with all of you. You also can share it with your students so that it will be very much useful for the student to understand the concept.
Did you know medication poisoning is the leading cause of child poisoning? Medications often look and taste like candy, and if kids can get into it, they will probably try. To keep kids safe, put all medicines up, away, and out of sight, and consider places where kids might get into it. In 67% of emergency room visits for medicine poisoning, the medicine was left within reach of a child, such as in a purse, on a counter or dresser, or even on the ground. And consider products you might not think of as medicine. Sunscreens, ointments, eye drops, and vitamins are medicine and can be harmful, so store them safely. And finally, put the toll-free poison help number where babysitters and caregivers can see it. Remember, the poison help number is not just for emergencies. You can call with questions about how to take or give medicine. Keep kids safe. And for more tips, visit our website.
So it is very important always in our home also some medicine should be out of reach from the young kids. So this is also very important. How to buy the medicine? Here the prescription is very important thing. Prescription is an order of medicine which the doctor writes and which is given to the chemist to prepare and give the medicine. Basically, it means prescription should be in the hand of us so that we can show the prescription to the shopkeeper and then only we can get the medicine from the shop. It is illegal. It is completely illegal to buy the medicine without prescription. That is the basic awareness we have to generate in our young students so that they also will not be habituated to buy any kind of medicine without doctor's prescription. We have to inbuild this knowledge in the young mind so that in future also they will not even dare to go to buy any kind of medication without doctor's prescription. But there is still some medication that we can buy without prescription also, and that is called the over-the-counter medicine. So over-the-counter medicine and prescription medicine, as a teacher we have to give them the clear idea about them. That is the most important part of this chapter. Because what are the over-the-counter medicine? That is basically not used for any kind of serious diseases. General diseases we can get the over-the-counter medicine, but if in any emergency situation or in any very serious illness, always we should consult with doctor and then only we should get the medicine. Now the next one, the option to buy the medicine. What are the different options we can take to buy the medicine? We can take the written prescription to the local pharmacy near our house, get the medicine mentioned over the prescription. We can also call the chemist shop and tell them to give the medication at your doorstep. But right now the WhatsApp and so many mail and so many things are there, so we can share our prescription with the shopkeeper so that based on the prescription they can provide us the medicine. Email is also another option. If you find it difficult to read the prescription, so then we can send the copy of the prescription to the specific pharma company, so that and the name and address will also be provided there. So many are there like that. In our society also 1mg like MedPlus, so many are available. So if we order the medicine in only one fingertip we need, the apps are available in our mobile phone. There also we have to upload our prescription. If we don't upload our prescription, they don't provide us the medicine. That is the very good attempt they have taken. So that we should always approach those kind of reliable place where they provide the medication only with the help of the prescription, not by our own choice. We can also even send the prescription to the pharmacy by way of the computer that is linked to the provider's electronic medical report. So if suppose electronic medical report, that is why electronic medical record is one kind of record. Suppose any chronic illness patient, suppose the patient is suffering from cancer disease, so that time the patient has to consume the medication for long-term basis. So that time one electronic medical record will be created by the hospital and the link will be there. We can directly share the link with the pharmaceutical provider, and if the means in the electronic medical record, wherever the doctor will change the medicine based on the situation of the patient, automatically the pharmaceutical provider, medicine provider, they will be aware about the change, and through that only from the hospital they can support us with the proper kind of medicine. So that is one very new upcoming thing. It is happening in different parts of our good hospitals also, and these providers electronic record also can be very helpful. Nowadays many websites are also available, like Apollo Pharmacy, MedLife, Pharmacy, 1mg, many more are there. These are the different options to buy the medicine. Now unit 2, the second part that we are going to deal with, how to buy a medicine. How? So in this part, basically the learning outcome we are going to deal with. The students will know about the manufacturing and expiry date of the medicine. That is very, very important. What kind of knowledge we can evaluate? The students will be able to explain about the prescription, over-the-counter medicine. Just now in the previous slide only I discussed on that. The students, that is the knowledge evaluation. As a teacher, we have to make sure every student of the class should get the knowledge. What is the difference between the prescription medication and what is the difference between prescription medicine and the over-the-counter medicine? That is very important for their life and our society. Next one is performance evaluation. How as a teacher you can evaluate the performance of the student? The student should check the expiry date and manufacturing date on the medicine. We only, as a teacher, we can bring one medicine strip in the classroom, or we can tell the students to bring the simple over-the-counter medicine, not any serious kind of medicine in the school. It is not at all acceptable. So, but over-the-counter medicine where the expiry date and manufacturing dates are mentioned, they can bring, or we also can bring. The students has to learn how to see the manufacturing date of medicine and how to observe the expiry date of medicine. So when the students will be able to do both of them, when they will identify both of them, so that will be evaluated as that evaluation will be done based on the performance evaluation. And next one, there will be the different teaching and training method, interactive lecture, chalk and talk method, or the activity we can ask the students, the students can basically ask their parent at their home that what are the different medicine strips are available, please give it to us so I can tell you about the expiry date. So they can create one data. As a teacher, you can see in the project file, you can assign your student one project file where they can write down the name of the medicine, what is the purpose of use of that specific medicine, what is the manufacturing date of that specific medicine, and what is the expiry date of the specific medicine. They will write everything in a specific data so that it will be one medicine bank. So the students will be making one medicine bank of their home, where what all the medicines present at the home of the student will be available along with the student. There the manufacturing date and the expiry date will also be mentioned, and the purpose or the use of the medicine will also be mentioned. So all the details will be in the student's hand. And we as a teacher can train the student in a way, in any kind of emergency case, the student can use the medicine for their home members or near and dear ones. If the expiry date is getting over, so by the time the student can inform the parents ki mama or papa, see the expiry date has got over, so we have to dispose the medicine. We should not consume any kind of medicine there, the expiry date is already over. So along with, and whenever any new medicine after the expiry date, when the medicine is going, it will be disposed, so that name will be cut and the new medicine will be taken from the shop, and there the student will mention. So in the way, the student will learn how to make one medicine bank at the home, and it will be really useful for their house. Next one, the objective. The objective is discuss about the students will be able to discuss about the brief about the prescription and how to use it to buy the medicine. Means what are the different parts, how to write the prescription. Differentiate between the over-the-counter and prescription medicine. The students will be explaining how to identify the manufacturing and expiry date. Already we have discussed all those things. Now the next one, prescription is basically means how to write a good prescription. That is very, very important. A prescription should have details related to the doctor, means a prescription should have all the details related to the doctor. Okay. So what is this basically? It will, the doctor's full name always should be printed in the letterhead. The doctor's details like the address, consultation time, contact number should always be printed on the letterhead. We should not, means whenever we go to any doctor, if the doctor is writing the prescription only on the white A4 size page, we should never encourage that. Always we should request to the doctor for the specific letterhead where the doctor's means that number is given, proper consultation time is given, contact number is given, address is given, every details of the doctor is given, and in proper letterhead the doctor should write the prescription. That is very important. Qualification of the doctor also should be mentioned in the letterhead. We should check that. Means simply we go to the doctor, and means if doctor is providing us any prescription, that prescription should have some value. We always should check that everything should be mentioned in the prescription. His registration number should be mentioned, registering authority should be mentioned, everything should be printed on the letterhead. And the date of prescription is very, very important, because we also have seen any prescription maximum it is valid for 3 months. If we go to any medical shop to buy any medicine and the prescription is very older prescription, basically the medicine shop or the online card, they don't allow us to take the medicine based on the old prescription. So the date of the prescribing is always should be mentioned there. Rubber stamp of the doctor containing his full name, qualification, registration number should be there, and the most importantly means that is the signature. Signature of the doctor is mandatory in the prescription. So we have to teach our student in a way so that our students, they in their small age also, they will be knowing everything. They will be aware of everything, how the prescription looks like, what is the importance of the prescription, what is the use of the prescription, so that whenever they will go to the doctor, they also can check all those things, so that it will be very much benefit for our society. So now the one video is there. In this video it will be showing off how the prescription can be helpful, means what is the basic use of writing a good prescription. So here in this video we have discussed how the prescription can be useful and what we have to check whenever we are taking the prescription from the doctor. So we have to check how the prescription should be written. One question is there: is there any use of any expired medicine? The expired medicine we should never consume. In our first lesson, life of vaccine, there we have seen that in our CBSE NCERT book only, CBSE book only, it's clearly written the expired medicine, either it will be less effective or no effect will be there in the expired medicine, and sometimes it can be life threatening also. So we should never and ever take the expired medicine. It is very, very dangerous. Either it will not have any effect in our body. So if the medicine will not have any effect in our body, there is no use of taking the medicine. And in other way, sometimes it can do the chemical change by itself and it can be life threatening also. So we have to make sure, as a teacher, we have to be very sure about the use of the medication, and after that we have to train our students in a way that they will be aware about the use of the medication, the buy of the from where they will buy the medication and everything related to medication. Now the prescription, how to write a good prescription, already we have seen in the video. The details of the patient should be written, full name of the patient should be written, age and weight of the patient should be written, address and contact number of the patient should be written, and then the gender of the patient should be written. And next one, in the prescription the details of the medicine also should be written. How many medicine should be taken per day, and when the medicine should be taken with food, without food, that also should be mentioned. If possible, we can request the doctor to provide the time guideline also. Now, suppose sometime when we are taking the antibiotic medicine, it is very much helpful if we take the antibiotic medicine. Suppose night 9 o'clock we are starting to take the medicine, so morning 9 o'clock we should take, because we are forgetting to take the medicine as soon as we remember we will take the medicine, then the effectiveness of the medicine will be reduced. the time when basically antibiotic works in our body in the time gap of 12 hours. So if night 10 o'clock we are taking, we should take it on morning 10 o'clock. So that kind of timeline, some medication that we have to ask our doctor, ki doctor we should take the medicine along with the food or without the food. Sometimes the doctor they are so much busy though they don't even tell us when we should take the medicine. Only they write the name of the medicine, they write the dosage of the medicine, but they are so busy, they are so much busy people that they don't tell us when to take, how to take, how the administration of the medicine will be more effective. That we have to make sure as a teacher. First we have to make sure, after that we have to train our student. Suppose if they are facing any problem in their life, they are going with their parents to any doctor, they can ask the doctor, when my mother should take this medicine, please write down the time, and the medicine should be taken with food, without food, what is the time gap should be there in between the administration of the medicine and the food taking. Everything we have to train our student to clarify in the doctor's room, so that it will be really helpful for our society. The strength of medicine, dosage, tablet, syrup, instruction, quantity, everything should be mentioned in proper way. So the dispose of the expired medicine already we will tell, because in this topic the last part is the disposal or safety, safety disposal of the medicine only. So we will discuss on that point basically. Now how to buy the medicine, over the counter medicine and prescription medicine. Over the counter medicine should it will be the purchase should be done without a prescription, or it can be purchased right off the sleeves at the store. Is the video available now? Manoranjani ma'am? Just 1 minute. Maybe the this one is. Ma'am, is my screen?
No, ma'am. Right now it is not visible.
Yes, ma'am. That's why I am stopping it and I am making it one more time.
Okay.
Check, ma'am, once it is visible or not now. I think it's visible now. Okay. So over the counter medicine and prescription medicine, so these difference we have to tell our students ki over the counter medicine we have to purchase without a prescription or can be purchased right off the sleeves at the store. Prescription medicine will only be available with the valid prescription. So then the basically the OTC medicine, over the counter medicine, that is that are monitored by the FDA and who is FDA, that also we have to we have to make sure our students should know who is FDA. FDA is the Food and Drug Administration. So that is the in Indian government, so Food and Drug Administration Department. So Food and Drug Administration Department, they basically give us the authority to sell the medicine to the shop, different kind of online cart or medicine shop. From the Food and Drug Administration Department only they get the license. So the prescription drug must pass through the clinical trial phase, approved by the FDA and monitored for safety and side effect even after the drug is on the market. So over-the-counter medicine can be used by more than one person. It can be used. Suppose we have taken one strip of paracetamol at our house. So suppose if I am getting the fever, I can use. After that, if my husband will get the fever, he also can use. So if my mother or father is getting the fever, they also can use. So over-the-counter medicine can be used by many people. We can bring one strip, keep it at our home. Many people can use that because it is safe to use. But prescription medicine only should be used by the individual whose name is written there. It's not like that ki suppose today I am getting one serious illness, I am buying the medicine, it is left over at my home. On the next few days, if any other person of my house is getting the disease, they can consume the same medicine. No. It cannot be done. That time we have to tell that person to visit to doctor once again. Maybe based on the body weight, body height, the BMI, the dosage can be different. So whatever medicine is effective for me, maybe that same medicine cannot be effective for my husband. It is not at all possible thing. So that's why prescription medicine is only for the individual. Sometimes as a parent also we do that. Basically, suppose our kid, two kids we have, one of our kid has got some fever or something, so we bought some medicine, doctor has prescribed some medicine. When the next kid get the same illness, we give the same medicine to our next kid. But it should never be done. As a parent also, we have to be very, very careful about the usage of the medicine. Without the doctor's consultation, we should never give any medicine to any house, means any member of our family. That is very dangerous. If the dosage will change, so that also can create the horrible problem or terrible problem in our body. Okay, so that also we have to make our students aware about that thing. Now the next one, the identification of expiry and manufacturing date of the medicine. So how to identify the manufacture date? The first two digits, like 19 is written there. It will refer the manufacture year, that is 2019. Now the next one, next two digits 03, that will identify the month. So the March, 03 means it is the March month. So that is the date of the manufacture. The following the two numbers 22. So it will be referred as the year. So suppose it is written as 1903-22. So that means the specific medicine has been manufactured in that is the year, and the next two digit will be the manufacturing month, and the following two number will be the day of the year. 22, that is the day, means 22nd is the day of the year. So 22nd March 2019 is the manufacture date of the medicine. The last one is the day. The second two digit are the first two digit are the year, second two digit are the month, third two digit will refer the day. So based, whenever we will see any 6-digit number on the back side of the medicine strip, so there we have to be very, very careful about the manufacture date of the medicine. So because based on the manufacture date only, the expiry date will be dependent. So now we will see another video based on the manufacture of the medicine, how the medicine are getting manufactured in our means pharmaceutical companies. Okay, so we have seen how the medicines are getting manufactured in our society, and after that expiry date and manufacturing date also we have basically we have seen how we have to train as a teacher, how we have to train our student to see that, and how to see the expiry date, the date till the medicine or the health product will maintain its purity or the physical characteristic. That is the definition for the expiry date. The date is given on the back side of the medicine, where it is clearly mentioned ki this is the expiry date. That means up to this date, the medicine will maintain its purity and the physical characters. So the year of the manufacture is represented by the first 2 digit of the batch number. The third and fourth digit of the number refers to the month of the production. Fifth and sixth digit will identify the day of the manufacture. So here we can see some difference in between the manufacture date and the expiry date. Manufacture date, what was the first 2 digit? That was the basically the year. Second 2 digit were basically the month, and third 2 digit were basically the day. In case of expiry, the first 2 digit will be the batch number. Third and fourth, these 2 digit will refer the month of the production, and fifth and sixth will refer the day of the manufacture. So where is the expiry date mentioned in the medicine? Basically the expiry date is mentioned or stamped on the back side of the medicine, written as the EXP dot. EXP dot. Sometimes it is written as expiry date, but some medicine we can see only EXP dot. So EXP dot means we have to make sure that is the expiry date. Now here we will talk about something more about the expiry date of the medicine.
Can you take expired medication? Hello, I'm Lamsing Root. I'm the pharmacist in charge at NowRx Pharmacy in Orange County. The expiration date on most medications is the date at which the manufacturer can still guarantee the full potency and safety of a drug. However, there's a fair amount of evidence that if stored correctly and intact, most medications are still good for more than 3 years after their expiration date. So keep your medications stored in a cool, dry place. Examine them for signs of physical decay. And if you have any questions, give us a call at NowRx or email us at info@nowrx.com. Can you take...
So, Marananjani ma'am, are you there, ma'am?
Yeah, I am here only.
Yes, ma'am. So
Okay.
unit 3,
Yeah. Okay,
yes,
okay.
Okay.
Now we'll start with unit 3, and it is this particular chapter is very much connected with unit 2. Unit 2 we were talking about the expiry date and manufacturing date. Here we are talking about the storage, how to storage the medicine, store your medicine. So here in this particular unit, and we first of all identify what is the learning outcome. The teachers must be very careful about the learning outcome. So here in this particular unit, and students will know about how to handle medicine. So here also I think awareness is important. The children must be aware about how to handle medicine. So that is the learning outcome, the awareness of handling the medicine, how to store the medicine, that is the learning outcome. So the knowledge evaluation explain, the children must be able to explain about general storage and handling guidelines for medicine. So which are the guidelines for handling medicine and how to storage? That is general storage of the medicine. Children must be able to explain about it. That is the knowledge evaluation. Performance evaluation, that is a kind of assessment. Check the storage of medicine at your home if they are stored properly. So the children, they can identify whether at home we are storing the medicine at the proper place. So that is very, very important. So from own experience, here also from own experience, and they learn. So the assessment, I think we can have it as an activity where the children can find out where should we store the medicine, and which is very, very important. Now, the methodology, when we talk about the methodology, it is activity. The children, they learn through the activity and through experience. So the book activity also must be given. Identify the medicine present at your home and see if these medicines are stored properly. So first of all, we start from home. Every house, I think, somebody will be using the medicine, and where we are keeping the medicine, and what is the expiry date and what is the manufacturing date. The children need to have an awareness on this, and from own experience, they need to learn it, and then surely they'll think about the storage in the medical shop also. So this chapter is talking completely about how to store the medicine, even with us at our house. How shall we store the medicine? Next slide, ma'am, please. Okay, so now we talk about the objective. The objective of this particular unit, store of your medicine, and the procedure. The children, they must aware about the procedure for keeping medicine very safely at home. And they can, they surely must be able to explain about the procedure for storing the medicine properly and why it is important to store in a particular place. So that is the objective of this lesson. Now, next slide, please. And here we are talking about storing medicine, most of the medicine. And here the children, they study the process. Most medicine should be stored in a locked cupboard or locked container, which is out of reach of children in an area that is below 25 degrees Celsius. So the temperature of this, keeping this medicine of that particular area, the temperature is also important. And it should not be at the place where the children, they can access the medicine. So it is very dangerous with the children and even the adult also, when unnecessarily or unknowingly, if you are taking some medicine and without the prescription of the doctor, it is very dangerous. So it should be away from the reach of the children. And the temperature is also important. The children must be aware about the temperature at which we are supposed to store it. And it is very important, it should be away from the reach of the children. A few medicines such as asthma inhalers may need to be readily available, and in these circumstances must not be locked away. So certain medicines, anytime the patient must be able to use it. For example, asthma inhaler. So the patient at times immediately they are supposed to use it. So it should be at the reach of the person, the patient, and make sure that it is not at the reach of the children, but the patient reach. So it must be under the custody of the patient and safely they are supposed to keep it. And this should be locked. That is also there. Even if it is at the reach of the patient, make sure that it is locked and only the patient can open it. And store your medicine in a cool, dry place. You can also store medicine in a storage box or a shelf in a closed storage place, or even closed box. That is very important. It should be in a cool place and dry place. Children must be able to aware about it. So they need to take care of this is this storage, which is very important. If you are keeping it in a very hot place, then surely the medicine gets spoiled. So the children must aware about that thing. For the safety of the patient, safety of the medicine also, and where we are keeping, the children surely must be able to aware about it. And it is best to keep medicines in a purse or a separate bag when you travel. So while we are traveling, the medicine should be at a separate purse or a box, and where the patient can be able to take it and have it, and it should not be at the reach of someone else. Take care of during the hot summer months and frigid winter months if driving to the chemist, as both high heat and very low temperature is bad for medicine. So very low temperature and very high temperature is not good for the medicine. It is the average. That's why we have seen that around 25 degree. So that is the exact temperature at which we are supposed to keep it. That's why the box, while we are traveling to a very cold place, and make sure that the box containing, and we are keeping that in a very safe custody, and the temperature also we will be able to manage it. Same way, very hot place also, we need to store it in a box, and then the temperature, and the box should be kept in that temperature where it is not too hot or too cold. So this awareness surely must be given to the children. The children must be serious on this particular storage matter. So that seriousness should be given to the children while we are helping them to understand this particular chapter. Next slide, ma'am. Okay, next slide, it is talking about keeping medicine safe at home. So safety at home, which is important. Where is the best place to keep your medicine at home? Don't store your medicine in the bathroom cabinet. Do not store it above the cooktop or fridge either. Make sure your medicine are up high and safe. So always check the date on your medicine. So it should not be inside the fridge or at the top of the fridge or in the cockpits and where the cockroaches are reaching. It should not be inside the bathroom. It should be in a neat place, and the temperature should also be safe for the medicine. And the medicine are up high and safe for the children. They are not supposed to reach at the medicine, and the date of the medicine also always we need to think about the date of the medicine. Next slide, please, ma'am. Keeping the medicine, okay, again we are continuing with that safety at home, medicines at home. Store all medicines up and away and out of sight and reach to be safe. Medicine should be stored out of sight in a high cabinet or a drawer where children cannot see it and out of reach. So it should be in such a place. We already have seen it, and this should be given more importance. It should not be at the reach of the children. By seeing the shape of the medicine, color of the medicine, children may be attracted to have it. So they may have a curiosity. So, and that will be dangerous for the child to take the medicine also. So that awareness should be given to the children. Keep medicine in its original child-proof packing. Medicine should be stored in a child-proof package. So that's why it is better to keep the medicine in a child-proof package so that the children are not able to consume it as it could be life-threatening. Listen for the click. Make sure your safety cap is locked. It should make an audible click. So the lock of the box, it can be the lock and which has a sound. While we are locking, it produces a sound. So that kind of thing, and we understand that whether it is get locked or not. So that is more safer. So the safety, see how far the safety is for the medicine. Let the children understand about it. Teach your children about medicine safety. Tell your children that medicine should only be given to them by an adult, and they should not take it alone, thinking it to be candy, and make them learn about the expiry and manufacturing date mentioned on the medicine. So make sure that the adult is handling with the medicine, and the children should not take it and eat it directly. It should be with the guidance of the parent. So expiry date is also important. Every time we need to think about the expiry date. Sometimes when we are taking medicines continuously for a long time, consider buying lock boxes, a small safe and lock box to click up all medicines and drug to maintain its effectiveness. If we are taking medicine continuously, it is better to keep a lock box for keeping the medicine. Next slide, ma'am. I think that is one video. You can watch the video.
For medication storage, a lot of people like to store their medications in pill boxes and containers. So I'd keep it in a different place in the home where you're easily going to remember to take the medication, whether that be in the kitchen or bedroom. A bathroom is a common place for people to keep their medications. They like to keep it by their toothbrush. And in the bathroom, it can often be humid with the shower and the tub. So we generally recommend avoiding the bathroom for medication storage. We also would say avoid any place with extreme temperatures, so avoiding the vehicles. You can degrade the medication.
Yes, ma'am.
Okay. So now next slide. So you might have understood the seriousness of where to store the medicine. Now next is how to use a medicine. So here in this particular unit, this is the 4th unit. In this unit, and we are learning about how to use a medicine. So here the learning outcome, which is very important for the teachers. Make sure that you follow the learning outcome. The children at the end of this lesson, they are able to identify medicine not fit to use. So here the children, they are identifying. which are the medicines that is fit for use and which are the medicines that are not fit for use. So here the knowledge evaluation is explain and identification of medicine not fit to use and procedure to have them. And then performance evaluation assessment we can have, and the children can demonstrate what is the secure and unsecure medicine. And the teaching methodology is interactive always, and then we can have activities and you can show the videos, and book activity is identify the safe medicine and unsafe medicine. Here the children, they get an awareness about what are the safe medicine, unsafe medicine. They can identify that medicine also. So that is the learning outcome. Next slide, objective. We'll go to the objective. So here objective is explained in brief how to check the medicine is safe for consumption. So what is the safety measures while we are consuming a medicine? Here the child must be able to explain about what are the safety measures. Discuss the procedure to consume different kinds of medicine. So that also is another, the children can discuss on that, and we can have a discussion in the class about the procedure of consuming the medicine. Next slide, ma'am. So here in this particular chapter and unit 4, this particular chapter, and we talk about consumption of medicine, proper way to take medicine, and take the prescribed dose at the same time each day. Don't skip dose or take half dose to save money. Take medicine until it's finished or until your doctor says it's okay to stop. Don't take medicine prescribed for another person. Here, consuming, how to consume the medicine before food or after food, and the dosage. One medicine, one tablet or half of the tablet or 2 tablets, that surely must follow the doctor's advice. So that is very important. And never take a medicine if you have same symptom and another person is taking a medicine with the same symptom without the doctor's advice. Never take a medicine if somebody is using. If you have same symptom, that maybe the reason may be different. So that awareness should be given to the children. So it is very important for not only the children, every one of us. So let them be serious on this. Next, here routine medicine and their explanation. Here routine medicine, buccal, cheek, inside the cheek. Certain medicine we keep inside the cheek. Related to the intestine, delivered directly in stomach or intestine. We are swallowing or taking inside. And next to medicine, inhalable. So we inhale, breathe in through tube or mask. Nasal, given to the nose by spraying or pumping. And ophthalmic, related to eyes, given into eyes by drop, gel or ointment. Then oral medicine, swallowed by through the mouth as a tablet, capsule or liquid. And then topical, that is ointment, cream, lotion applied to the skin. And sublingual, tongue, held under the tongue. Otic, relating to the ear, given by drops into the ear. These are the different kinds of medicine, and we call it as route of medicine, and how we are using and where we are using, that also is being explained. And this, children can prepare it. They can identify, they can prepare, the teachers can support while the children, they are preparing. And how to use a medicine safe or not. 5 main points that we should check before using a medicine. Give it to the children, which are the 5 safe points before we take a medicine. It should be the right patient. The patient should be the right person, and where he has the same kind of disease or the right kind of disease. The right medicine for that particular disease, it should be the right medicine, and the dosage, that should be the exact right dosage for that particular person, and the right route. We said route means either through the mouth or through the nose or through the skin, and that is the route. And the right time, the timing is also important. So the 5 main points, and one we have seen, the right patient. Whenever you go to the doctor, always take a list of medicine you have been taking and ask your doctor about the safety of the medicine if he prescribe a new one. So if you are consulting a doctor, what are the medicine now you are presently taking, the doctor must know about it, then only the doctor can prescribe a proper new medicine. And next point is choose a chemist and a doctor you feel comfortable talking with about your health and medicine. So safety, here also safety measures has been given, and choose a doctor where you feel you are comfortable to discuss with the doctor. Make sure your medicine is what the doctor ordered. So please kindly follow that particular medicine which the doctor has given order. Ask how to use the medicine correctly. So that also, if you have any doubt, please talk to the doctor once again how to use the medicine properly. Side effect can occur with many medicines, so ask your chemist and doctor about the possible side effect. So the patient must know about the side effect of the medicine. So then the doctor can advise you if you have some other ailment and it is having the side effect, and what are the side effects, how can we avoid it, and that should be discussed with the chemist or even to the doctor. So these are the safety measures which we are supposed to have it. Let the children know about it, and the children, they can help the patients at home, they can help everyone, and let the children aware about these safety measures while we are taking the medicine. Next slide, please, ma'am. Now, next is how to dispose the medicine. Disposal of the medicine, that is also very, very important. We should not dispose it at a public place or even a place which is not safe. So here in this particular unit, learning outcome, students will know how to dispose expired medicine. So they get awareness on how to dispose, throw away a medicine and where to throw it. So that is the learning outcome. They need to have an awareness on it. Knowledge evaluation, they must be able to explain the procedure of disposal of medicine that are no longer in need. So the unwanted medicine should be how to dispose it in a better place or even safer, safe for us. So the children must be able to explain about it. And then the evaluation, performance evaluation or assessment is, they must be able to demonstrate safe disposal of medicine. They can demonstrate how to throw the medicine very safely in a particular place. And here also the teaching methodology, it is lecturing method, discussion method, and experience sharing method, and the book activity here, perform safe disposal of expired medicine and inculcate this habit and follow as a life skill. So how to throw the medicine or dispose the unwanted medicine or expired medicine, and let it be a habit for the children or even adult. So it become a life skills. So these life skills, and they are getting several life skills like better communication skill they are getting, and practical skill. This is again a practical skill which we are supposed to make it as a habit in our life. So that is the skill they are getting out of this. Next slide, please. Now the objective, we can see the objective, and the children must be able to discuss when to dispose a medicine. They must be able to find out, and sometimes the expiry date not over, but it is not suitable for the patient. So that again we are supposed to dispose it. So they need to know about or understand about when and how to dispose a medicine. When to dispose the medicine is also very, very important. They must be able to discuss on that. Explain the procedure to dispose of an unused expired medicine. So unused medicine or expired medicine, how to dispose it, what is the procedure, the children must be able to explain about it. That is the objective of this particular unit. Next slide, please, ma'am. So here we are talking about the damaged medicine and which medicine can be termed as damaged. So that's very important. Any medication that has changed color or consistency regardless of expiration date, and you can also check the smell. Discard pills that stick together are chipped or are harder or softer than normal. So these are the damaged medicine. So you can see whether it is sticking to the cover, whether it is changing its color, and expiry date is also important, whether it is too hard or too soft than the usual, and this kind of medicine cannot be used. So this, I think, how can we identify the damaged medicine, so they can make a list, and which condition the children they can discuss and they can make a list. And next slide, please, ma'am. When to dispose medicine. Your healthcare provider changes your prescription, but you still have some medicine left at that time, and you are changing your medicine as per the advice of the chemist or even the doctor. That time the balance, the previous medicines you are supposed to dispose. You feel better and your provider says you should stop the medicine. So again, while you are stopping the medicine, you are having few more pills with you, that also we need to dispose in a safer place. You have OTC medicines that you no longer needed, so that also should be disposed somewhere else. You have medicines that are past their expiration date, so the expiry date over. So such medicine also you are supposed to dispose. So this also the children, they can make a list. When shall we throw a medicine? So how to dispose the medicine, and they can make separate 2 charts. So let the children make the chart. So that is another activity can be given while we are helping the children to learn this particular unit. Now next slide, please, ma'am. Again, we are talking about the safe disposal of medicine, correct method to dispose the medicine. So what is the correct method? So that is very, very important in the picture, and you can see what is the correct method. Never flush unused medicine down the washroom where they could make their way into the water supply. Instead, mix the pills or liquid with coffee grounds and cat litters or another material that makes them unpleasant, and put the mixture in the trash. So we are supposed to use a trash box, and where never flush it in the washroom, and you can mix it with I think liquid coffee grounds or even cat litter, and then put it in the trash box. So that is the safer way. The best way to dispose your medicine is to bring them to drug take back program. These programs safely dispose of medicine by burning them up. These type of programs are organized in many states. So we can give it back to the drug take back. There is a separate program by the pharmaceutical companies. So you can give it over there. Then we need not have any burden. They will burn the medicine at the right place at the right time. And place the mixture into a sealable plastic bag or sealed containers that won't leak, and dispose in the trash. So we are supposed to make these particular pills in a plastic cover which is sealed one. So then dispose it into the trash. Then it won't leak. It won't create another other damages. Remove all the personal information from the medicine bottle. So medicine bottle contains all the kind of best information, and how to use it and how to throw it, and all the details are there. So we are supposed to read all the details from the bottle itself. So this also, I think the children, they can discuss on this, and they can make an activity, like they can write about it. And you can see the bottles where all the
The best way to dispose
Please watch the video.
of expired or unwanted medicine is to use a drug take-back location. If this isn't an option and your medicine is on the FDA's flush list, flush it down the sink or toilet. If your medicine isn't on the flush list, dispose of it at home by mixing it with an unappealing substance like dirt, cat litter, or used coffee grounds in a sealed plastic bag, and put the sealed bag in your household trash, and scratch out any personal information from the label on the medicine bottle or packaging. For more information and to find a take-back site near you, visit www.fda.gov. Visit The best way to
Thank you, ma'am, for sharing this. And FDA, that is Food and Drug department, administration department, you can go to the site of the FDA and you will be getting better information. Let the children go through this particular site and get more information. Okay, thank you. And this particular book also we just completed.
Just I want to share some information here. Actually, some teachers have asked some queries based on the session. One teacher has asked that if it is the proper time we can give the information about the medical safety and everything towards the students. Is it a right thing to do or not? So I think it is a right time, ma'am, because whenever we are as a teacher or we are teaching anything to our student in the right way, it should always have the positive impact on the student. So even though they are in grade 6 or grade 7 or grade 8, where means they are very young children, but as a teacher, if we can implement or we can teach them everything in the right way, in right perspective, definitely the students will understand the situation, they will be aware about everything, and based on their sensitization only we can shape them in a way, because they are the young mind. If we give our input in the positive way, they will take it positively. So it is, as a teacher we can do this, ma'am. It is very much useful.
Surely we need to give an idea about this. Safety of the medicine usage is very important. Children must know about it, I think.
Yes, ma'am. And what about the side effects of homeopathic medicine? One more question is also there. So, homeopathic medicine, actually, ma'am, allopathic medicine is basically made up of the lots of chemicals we are using. But homeopathic medicine, that much chemicals are not used. That is more safe to use, actually. And in our ancient Indian culture system also, if we see, that is the Ayurvedic medicine or Unani medicine, so they are only basically we were habituated. But this allopathic medicine, basically it came in 1804. Before that, the ancient medicine only we used to use. So that's why side effect, if we talk about, it is more side effect we can see in allopathic medicine. Homeopathic medicine means hopefully it will not be that much side effect will be available in homeopathy.
Yeah, ma'am. Shall I add to it? And this
Yes,
allopathic medicine, it is chemical and we all know, but at times we need it. If we have an ailment and illness, the right kind of, the doctor has to identify the, illness and disease. And that time we are supposed to take it, and it is important for us to take that medicine. And homeo, I think most of the medicine, and it is been taken out from the plants. So that's why it is not having that much side effect. So the chemicals are less. That's why we understood about it.
Yes, ma'am. One more question is also there, that when we are keeping the medicine, storing the medicine in the refrigerator, so like the cough syrup, it is not means told to keep it in the refrigerator. It is generally told to that you can keep it in the normal temperature. So that kind of medicine also should we keep in the refrigerator or not? Like that. So I think in every medicine bottle it is mentioned keep whatever temperature should be mentioned for that specific medicine. If it is written that it should be refrigerated, then only it should be refrigerated. If it is not mentioned, so then in normal temperature only we can, it is preferable to keep them in normal temperature. No need to keep them in refrigerator.
I think allopathic cough syrup, it is very important. Some of the medicines have drowsiness. So if the small children, if they drink it and they get drowsiness, they sleep more and they may be having side effect. There must be having side effect also. So it is better to keep all the medicines at the safer place. And the temperature, you can see that 25 degrees the temperature. That is the normal temperatures. Not too hot and too cold. So that is the average temperature. It is better to keep at a safer place at the same kind of 25 degree around that temperature.
Yes, ma'am.
Kyali ma'am, Manuragini ma'am, it's 1:36 now. We should have a lunch break.
Yes, ma'am.
Okay, we will meet again after half an hour.
Okay.
With all the audiences also.
Yes, ma'am.
Okay, both of you please take your lunch and take a heavy lunch. After that, you also supposed to throughout the that time till we reach at the ending need to speak.
Yes, ma'am. No problem.
Yes,
Yes.
ma'am.
Okay, ma'am.
Okay.
Thank you.
So
Thank
by
you so
what
much.
time we should come back? Like 2:10, we can resume once again.
Yes, yes, yes. By 2:10 or 2:15, we can resume.
Okay,
Okay.
ma'am. Thank you, ma'am.
All
Thank you.
right.
Okay.
Thank you. Thank you so much.
Thank you, ma'am.
Shall we start, ma'am? Are you there?
Yes, ma'am.
Okay. Jyoti ma'am, shall we start?
Yes, Manoranjani ma'am, Pyali ma'am, we should start.
Yes, ma'am. Now I think Pyali ma'am, you can start.
Yes, ma'am. Okay. So I will share my screen. The last part we have to do right now. Is my screen visible, ma'am?
Yes, ma'am, your screen is visible.
Okay. So now we are going to start the last part, that is called the what to do when doctor is not around. The subject code is 916, that is grade 6 to 8. So yeah, this is the most important and most interesting part of the session. As of now, when I was preparing also, I got really I only got enthusiastic with this part because it was very nice. So many home remedies are there, so that whatever small things are available, very much like in our kitchen only, everything is there. If we think about it, means when we will learn the whole session, means then we will come to know that every medicine is there in our own house, but we don't know how to use that. So it is very important, this one. The first one, that is they are telling about and here only 2 units are there. Unit 1 is common sickness and unit 2 is how the home remedies can be used in proper way. So the first one, in the common sickness, we can see the first one, the students will explain about some common sickness and their symptoms. So when the students will explain about their common sickness and their symptoms, so they have to understand about what are the different common sickness we usually get through, means what are their different causes and how these common sickness means common symptoms are coming and how to get rid of. So that part basically the students have to understand. Next one, the knowledge evaluation. How as a teacher we can evaluate the knowledge. We have to see the students are able to answer or explain about the common sickness or not. That is the main motive. Means every student has to understand about the common sickness. What is the serious problem, serious illness, and what is the common sickness. The difference between these two. Every student, as a teacher, we have to make sure that every student has understood that is what is the common sickness and what is the serious problem. What are the performance we can evaluate as a teacher? How to cure some of the common sickness. That means we can make one role play in the class, or we can ask the storytelling session, and we can tell the students to share their experience when the student is getting any problem or any kind of problem, any kind of common sickness in their home. So how the parents are helping them, or suppose sometime grandparents will give some nice home remedy and that will work like a magic. So that time it is really very nice, and those kind of thing we also can get some idea as a teacher from our parents, from the students also. So when the students will share some extra information, so we also as a teacher we also can gather some those information and we can keep it ready with us, and in our teaching session we can include that also. That's very useful actually. Teaching and training method, interactive method is there, chalk and talk, and the activity method is that is the list some of the common sickness and what to do cure them, what we should do to cure them. So they will list that what are the different common sickness means usually the people are suffering from, they have to list it down, And what are the different home remedies are available at our home to get the relief from that common sickness? Number 2 and number third, how to cure them. And if possible, we can add one more point also, how to prevent that common sickness. So in these 4 part, the students can make the project work also. That will be really helpful. Objectives are like basically that they will the students will learn about some common sickness and know about the symptoms and causes of the diseases. The first common sickness, if we see the very common sickness, whatever problem is happening in our body, at last the show off is the fever. Whatever common sickness is coming, we are getting the stomach infection, the symptom is fever. We are getting cough and cold, the symptom is fever. We are getting like tonsillitis, the symptom is fever. We are getting sinusitis, the symptom is fever. So fever is the most common sickness. First the fever will come. Then we will go to doctor and doctor will diagnose what kind of problem or what kind of sickness basically we are suffering from. So fever is the most common sickness. So in the fever when we see, so the importance of the fever is a very vital sign. Because whenever we go to doctor, you all may have seen the first thing the doctor will ask you, what was the grade of the fever? How much fever you got? It was 9900 or it is 101 and 102 or it is more than that, like 103, 104. So when you are telling about the grade of the fever, so then only the doctor will understand what kind of situation or what kind of problem it can be. So fever is very vital sign that tells how the ill person, if he is improving or not, or whether he is responding to the treatment or not. That means whenever fever is there, so the doctor will see the grade of the fever. It is the low grade fever, mild grade fever or high grade fever, and based on that, when the treatment procedure will be started also, the person is improving with the treatment procedure or not, because when the treatment procedure will be done, if the person will improve in the common sickness, so automatically fever will come down. So if the treatment procedure is not working, then the fever will take time to come down. So it is a very vital sign for a person to find out that the person is improving in the treatment or not. The pattern of the fever, that is very important. Rise and fall of temperature. Sometime in our home, sometime we can see if our children are getting the fever, if our kids are getting the fever, if it is any kind of urinary tract infection or urine infection, we can see very high grade fever, like 104, 105 the fever is reaching. As a parent, we get complete panic. And when we give medicine, till the time the antibiotic medicine we will not start, simple crocin or simple paracetamol if we provide, the fever will come down up to 102 and from after that it will start increasing. So it is very much panic situation for the parents also, for the for any kind of any parent, it is very panic situation basically. So when we go to the doctor, we rush to doctor with our kid and we tell the rise of the fever is very high than the fall of the fever, like it is not falling down to 100. So then only the doctor will understand, okay, that means the child is suffering from any kind of bacterial infection. As soon as the antibiotic will be started, then and there what will happen, the fever will, the rise and fall, that temperature will be changing. So if it will be changing, if our children are getting cured, then we can inform the doctor, yes, that medicine is working. So fever is very important vital sign, and it will tell us what kind of illness is this and the person is responding in the treatment procedure or not. Next one, the common sickness, the fever, the different types of fever. The fever can be either high or mild or moderate, any kind of fever it can be. So some of the common illness that can cause the fever like that are the mild fever, 99.8 to 104 degree centigrade basically. So like simple normal fever, it is not that much panicking situation, but no, fever is there. So if we get any cut and that it has become the wound or it is infected. Mild infection is there. That means the fever grade will be mild. If the fever, if we are getting any boils or abscess in any part of the skin, if any tooth abscess has been occurred, or otherwise if any kind of just 1 minute, infection of the middle ear, sometimes the children are getting that ear infection also. So in the case of the ear infection also, mild fever is possible. Cold, if it is mild cold, fever will be there, but the fever will be mild one. Moderate fever, in which case we can see moderate fever. What is the range of moderate fever? As a teacher, as a parent, we have to be very careful about the grade of the fevers. Mild fever means 99.8 degree to 100.4 degree Celsius. What is moderate range? Moderate range means 100.5 to 102.2. That is the moderate fever. In which cases we can see the moderate fever? Either in case of urinary tract infection, or basically in case of urinary tract infection, or sometime if the wound will be more infected, the fever range can be more also. And in which case we can see the high grade fever. High grade fever basically that is 102.3 and above that. If the fever is crossing 103 or 104 means it will be considered as the high grade fever. So high grade fever is basically observed in case of influenza. Influenza, when we got infection from the influenza virus, we can see the muscle and joint pain, terrible muscle and joint pain in the influenza. Then the high grade fever will come, like the fever range can cross up to 103, 104. Next one, when the measles are there, measles, mumps, this kind of viral infections are there. If the chicken pox is there, basically the viral infection, chicken pox, pneumonia. Pneumonia can be viral also, pneumonia can be bacterial also. In both of the cases, we can see high grade fever. Next one, we can see the high grade fever in case of typhoid fever. Typhoid fever, basically typhoid comes from the polluted water. Okay, and with the typhoid fever, we can see that severe headache will be there. So typhoid fever also sometimes we can see high grade malaria. Malaria is the parasitic infection. Okay, parasitic infection like the Plasmodium volvox basically is creating the malaria. So in that case also high grade fever we can see. Tonsillitis or the strep throat. Strep throat or throat throat, that is a common problem for everyone. Like whenever there will be that time of the weather change, we get the tonsillitis, our kids get the tonsillitis. Along if we drink something cold drink or if we eat one simple ice cream, then and there we get the infection of the streptococcal infection or sore throat or tonsillitis. We can see the enlarged tonsil from outside. The doctor will tell you to open your mouth, and with the torch or something, with the light, the doctor will see the inside how much the tonsil is increased and what is the grade of the fever. Both of the things the doctor will check and doctor will start the treatment. Next one, the diphtheria, that is not that much common. Meningitis is also not that much common. Diphtheria is basically happening if a case of any kind of cat bite. Okay, basically if we are having the pet cat at our home, so we give the injection to our pets. But if it is the roadside cat or something, means it is dangerous. Then and there we should meet the doctor and we should talk to the doctor. Meningitis is severe. Meningitis actually nowadays it's very uncommon because vaccination program is there for the meningitis. Meningitis is the meningococcus is the name of the bacteria which is basically causing, and it basically harms the nervous system of our body. So severe headache, vomiting will be there, and sometimes meningitis can be life threatening also. So anytime we are getting the fever, or anybody of our very close ones are getting the fever that is crossing 103, so then and there we should rush to the doctor and we should get the opinion from the doctor. It's very important, and we have to create that awareness among our students. If in their house, if anyone is not getting that much awareness, we can make the our students aware about this thing, the gradation of the fever, so that they can help their family members, their neighbors, their near and dear ones, and in this way, as a teacher, we can save our society also. Next one, I will show you one video that is the best remedy, home remedies for the viral fever. Morning only, Jyoti ma'am was asking about that. What are the home remedies we can do during the time of the flu? Whenever we are getting any cold, cough or flu or mild fever, so what kind of home remedies we can use? So we all can see the video. Sorry. Just 1 minute. Here all are writing it's not audible. That's why I was checking. It's audible. We have seen the home remedies. Everything is available at our home. Tulsi leaves, it is very easily available. Ginger, garlic, black pepper, tea. So these are very heavy available thing at our home. Easily we can get this kind of thing and we can mix it up. Simple. Whenever you are drinking the tea, you can add some amount of black pepper in that, crushed black pepper. Whenever you are using the crushed black pepper in the tea, then only it will help you to give the relief from the cough and cold. So, and we on my kids also, sometime when they get too much cough and cold, honey and ginger paste, paste or ginger juice, if we mix and give, I have seen that it works like magic. Means this kind of thing, like garlic also. Garlic is also very good for the lowering the blood pressure also. Curry leaves, that is very easily available. Curry leaves and garlic, if we take it together, it can help us to get our blood pressure lower. So many things we do, so many blood pressure medicines we take, but simple, 2 curry leaves and 1 garlic in the morning time in empty stomach if we take, we can easily, if we take it continuously for 1 month or 2 months, after that definitely there will be change in the blood pressure level. So these are the same means common sickness like that, but the blood pressure is not the common sickness. That is only one as a means option I have told you, but as per syllabus we have to talk about the common sickness. The next one, the second part is the headache or migraine. Headache is very common sickness. Tightness, pressure, bursting, throbbing, dull or steady pain in the head. Anytime it can happen. So when it happens basically, so where basically the headache is happening, both side of the head, all over the head, one side, front, back. So that location we have to see carefully. Because where the headache is happening, based on that, we can understand the situation of the headache. Because headache and migraine, if it is the headache and migraine, sometimes the person can follow the vomiting also, dizziness also, nausea also, it can come. How long it lasts? It lasts for minute, hours, days or week. Based on that also we can tell about the thing, how much serious the condition is. What time of the day basically the headache is happening? Waking up in the morning, mid-morning it is happening, evening it is happening, on which time the headache occurs. Whenever we go to doctor will ask for all these things. The location of the headache, how long it lasts, what time of the day we are getting the headache, everything the doctor will ask us. What condition can be, like the tension, what is the condition we are getting the headache? We are getting the headache due to an tension, we are reading in the night light, we are stooping of the head, cause of the attack, or means whatever situation it can be, we can get the headache. What condition, position, alcohol intake, etc. also make it more worse. If we are getting headache, so we have to keep our head straight. If we are feeling like sleepy somehow, so we can keep our head nicely on the pillow, and the neck portion should be supported nicely. Alcohol intake during the headache is strictly prohibited, because alcohol it will create the dehydration in the body and it will increase the headache. So the headache will be more worse if anybody will consume the alcohol during the time of the headache. So these are some prevention things are there. We can take it in our attention so that we can get some relief. How to get the relief? We can take some rest or medicine for the headache also. Some symptoms of the migraine, where in the diagram you can see that if the tension, too much tension we are having and we are getting the headache, means either the forehead portion we can get the head, or we can get the headache in the eyes portion, on the eyebrow and eyes portion. If it is a migraine headache, then we can get the headache on one side of our head portion, and cluster type of headache we can get it in one eye. So some symptoms of migraine: sensitivity to the light, noise or odors. Sometimes we don't, if we are getting headache, we are very much sensitive of the light. We don't like to, we just want to close our eyes, and we just want a stress-free situation, and like we don't want any noise or any strong odor or any light. So sensitivity of these things will also occur when we are getting the headache or migraine symptom. Nausea and vomiting will also be there. Stomach upset, abdominal pain also can occur. Loss of appetite can also occur. We are not feeling to eat anything because of the too much headache. Feeling very warm, sweating. Sweating also can happen. On the other hand, chill also can happen, cold. Either we will feel very warm or we can feel very cold. Person to person it can vary. So if we are getting too much headache, sometimes so much uncomfortable feeling can give us too much sweating in some person, and due to the sweating, after that the chill can come. The person will feel like shivering type of thing the person can get. Pale skin color, the pallor, that is called the pallor. The skin color will be completely pale. It looks like means the blood amount in the body has reduced. Everybody will see and say why you are looking so dull. So that kind of skin color will occur. Feeling tired means we are not willing to do any work. We are in so much headache. We are every time we are feeling to sleep only. We are not willing to do any work. We are not willing to go to our work also. So this kind of situation also can occur. Dizziness on blood vision. Sometimes we can see that we can't see properly. From the dark room, if we go to one light room, we can see one blood vision. We can't see. We can't even find out the object. Means we can't even open our eyes. So that is the dizziness and blood vision can occur. Tender scalp. Sometimes due to the migraine problem, if it occurs for long period of time, if it is a chronic problem, so the scalp also can be tender in nature. Now the next one, causes of migraine. Exact causes of the migraine is still not known. through the various triggers factors are associated with the physiological factor like the stress, automatically hunger. When we feel too much hungry, but suppose due to the work pressure or due to our means that time we are not willing to make in anything in our kitchen, we can think okay, some chips or cookies or something we can take, but that hunger is there, it persists. But we are not taking proper amount of adequate food amount. That also, these physiological factor also can create the migraine. Fatigue, if we are not taking proper amount of rest, if we don't take proper amount of sleep, so that time also this kind of problem will occur. So we can tell our students, as a teacher we can tell our students to take care of their health, so that they can regulate their physiological factor and they can get rid of the migraine, because the 6 to 8 means their age group is right now only the teenager. They are only the teenager, starting of the teenager age. So by the time if they will control their physiological factor, they will learn how to control their physiological factor. So automatically in future maybe they will train themselves in a way that there will be no migraine present. Dietary triggers basically includes the eating less food or dieting, or otherwise it can be delayed or irregular meals, or otherwise means morning we are taking one meal, after that evening means time lunch we are skipping. Many people we are having the habit of skipping the meal, so that is also very dangerous. Then dehydration, alcohol consumption, food containing high content of the tyramine. Tyramine, like for instance the dairy, meat, poultry or fish product, if we take it on high quantity, means if the vegetable quantity is less, and in the food if the tyramine or the meal protein, means in the meal the protein, where the animal protein quantity is very high, then also it can create the imbalance in the physiological factor. Caffeine products such as tea and coffee, in adequate amount it's fine to take, but large quantity of caffeine and caffeine or tea if we are addicted to, and if we are not getting that cup of tea or that cup of coffee on that specific time, we can get the migraine or headache problem. So that is also, suppose morning time we are habituated to take 1 cup of tea in the morning time, suppose in one day we are not able to take that. Many people have seen that then and there within 1 hour they will get terrible headache, because we have get the addiction of the tea and coffee. If we don't get it in proper time, we are getting the headache or migraine problem. Specific foods such as chocolate, citrus fruit or cheese also can create this kind of problem. Cause of migraine, environmental factors are there, very bright light. Sometimes if the migraine patient, if they will be standing or sitting long time in the sunlight, so they are also, due to the bright light, they can get the migraine problem. Smoke is also there. If the persons are having the dust allergy, they are going to the crowded atmosphere, they are means going to any kind of loud noise, changes in the climate or humidity, very cold or very high temperature, there is no cure actually, so only the prevention can be done. So dietary control always it should be there, or lie down in the dark or quiet place, be relaxed and take a deep breath and think. Don't think about any problem of the life. That is the most important thing. Many students have complaining, they are complaining that during the exam time they are getting headache. Why the students are getting headache during exam time? Because they are taking too much stress and tension in their life. So as a teacher, we have to be very careful, and we have to tell our students means don't take so much stress and tension. How much it is possible for you to do, you can do. Exercise regularly, or tension headache we can get rid of that. Management of migraine headache caused by tension is described as a pressure, tightness, aching, that pain feeling in the head, and it will last for hours or days. It occurs when the person is, screen is not visible. Okay, I will just do it one time. Now is it visible, the screen? Now is the screen visible? Please. So it is like any kind of depression. If the person is going to depression or nervous or anxious or cannot sleep, so there also the headache or migraine problem can occur. So treatment consists like the massage or relaxation. Manoranjani ma'am, can you please see the screen? It is visible or not? Here, they are telling that screen is not visible.
Kali ma'am, it is visible.
Visible, okay, ma'am, okay. So treatment consists of the massage and relaxation basically. Whenever we are taking the means when we take some massage, one massage, or sometime nowadays we are going to the different kinds of spa or parlor also. So there also we can get some relaxation. Now the next one, the eye strain headache, that is very important. Sometimes we can feel so much pressure on our eyes. So that is also means it seems like we are not able to open our eyes, and it seems some heaviness in our eyes. So these are called as the eye strain headache. And this is due to the prolonged use of the eyes. Basically, who are working in the IT companies or corporate companies, and where basically nowadays in case of teachers also and in case of students also, when we give them lots of work to do, maybe they are going to research in the computer and continuously, and mobile addiction is also there. Television is also there. So, in case of the students, as the screen time has been increased so much, so for the prolonged use of the eyes, it can create too much eye strain headache, and it can also correlate to the migraine problem. Headache caused by the sinusitis also, it is usually occur waking up and during the mid morning, and it will it can be so much worse where the person cannot be able to bend the head also, means the person cannot even think to take the head up. So these are the there are some common problem and of the migraine. Now we will see some home remedies that we can use in the migraine problem. So here some home remedies we have seen, that natural remedies we can use for the in case of the migraine problem. Now the next one, very common problem, common sickness is the cough. So to loosen the mucus and to ease the kind of cough, so drink lots of water, because these work better than any other medicine. How much our body will be hydrated, that much the mucus will be loosened up. And due to the cough, all the mucus will come out from the body, and it will be really helpful. Also breathe the hot water vapors. Sit on the chair with a bucket of very hot water at your feet. Please place a sheet over the bucket to catch the vapor as they rise, and that vapor should be deeply breathed in for at least 15 minutes. And it should be repeated several times a day. So when it will be repeated for several times a day, some people like to add the mint or some essential oil like the eucalyptus leaves or vapora. But If nothing is available at the home, no problem. Simple hot water vapor also we can take to get rid of the cough. And if it is not possible, suppose it is a children or small kid is there, so then simple, we can do one thing, 1 cup of warm water we can give our kids or children to drink. If they will drink that warm water, 1 cup of warm water, then and there, at least for some time, they will get some relief from the hard cough. Okay, many of us, we don't know that whenever we also get too much cough, it is uncontrollable. If we drink a little cup of warm water, that is very easily available. Anytime, any place we can get it nicely. So that will be really helpful to get rid of cough for some period of time. Next one, the cough, the treatment of the cough for all kinds of cough, especially the dry cough. The following cough syrup can be given, and like the pill, then finely grated ginger into the small bowl. Ginger is very good for cough. Squeeze the grated ginger through the fine mesh sheet, and then you take the juice of the ginger juice. Discard the pulp. And when the pulp will be discarded, mix the teaspoon of the fresh ginger juice thoroughly with the tablespoon of honey. The morning Manoranjani ma'am has also told the same thing, honey and ginger. That was very nice combination for the cough and cold and common flu. Ginger juice and honey, the mixture of that. And take the syrup right away and swallow it slowly and deliberately. And you should not take it at a time, you should take it slowly so that the throat will get some relief from the cough. When you will take it slowly, then the whole throat will get the comfort. Next one, they take 2-3 times a day as needed, or to soothe the sore throat and dry coughing. So it is really helpful, the honey and ginger juice. Next one, in the common sickness, the treatment of the cough, do not give honey to babies under 1 year. We should never give the honey to the babies under 1 year. For a severe dry cough that does not let you sleep, so then we have to go to doctor immediately, because ma'am also shared that if any kind of serious illness we are getting, we are not able to sleep at night, or we think that it is really out of our control, then and there we have to take the help from the allopathic medicine also. For a cough with the wheezing sound, sometimes like that one wheezing sound also comes along with the cough, especially in case of the babies when they are sleepy, and that time the baby is feeling very difficult to breathe also, or noisy breathing is coming. Then we have to go to doctor immediately. These are the warning facts. That time we can't do any home remedies. Then and there we have to go for the allopathic medicine. Try to find out what sickness is causing the cough and then treat that. If the cough lasts for a long time, or if the blood comes, or the pus comes, or the smelly that any phalgum can come in the cough, then and there we should go to the doctor. And difficulty in breathing also. Cold and flu are basically the common viral infection. If it is caused by the rhinovirus, it's not a problem. It will be giving one mild fever or joint pain or body pain. But after few days, automatically it will be all right. But in case of the young children, it can give some mild diarrhea also, but it is not that much tension thing. But if the fever persists for more than 3 to 5 days, then we have to seek the attention from our medical professionals. Cold and flu almost always go away without medicine, because as it is the viral thing, so automatically it will go away. If we don't give any medicine, if we take simple the vapor rub or normal vapor at our home, and we can take the honey and ginger juice mixture, so within few days only we can get the relief from the flu. Now the next one, drink plenty of water and get enough amount of rest. That is also very important. Inhale the steam. This helps to clear the stuffy nose, because when we inhale the steam, the stuffy nose, then and there it will be cleared out. No special diet is needed. However, fruit juice, especially the orange juice, lemonade, that can be helpful. Now, cold and flu and how to prevent that. Getting enough sleep and eating well helps to prevent the colds. Eating oranges, tomatoes and other fruits which contain lots of vitamin C. That's the most important thing, because vitamin C helps us to get rid of the cold and flu. Vitamin C is the protective vitamin that can help us to get rid of cold and flu. And the contrary to popular belief, colds do not come from getting the cold or wet. That is not the thing. When we get the cold, that time if we get wet in the like rainy season, then on there we will get cold and flu. It is not a that is a common belief. There is no medical thing behind it. Only when we get the virus, then only we can get the cold and flu. A cold is got from others who have the infection and sneeze the virus in the air. Actually, during the weather change time, many people are having the cold and flu. So when they are sneezing, so the virus is automatically moving in the air. When we inhale that, we are getting it. And during the time of weather change, automatically there will be the change in the temperature. So that's why we can think like that, yes, we are getting it due to the cold temperature or warm temperature. But it is not like that. To keep from giving the cold to others, the sick person should eat and sleep separately. So we can take the special care for the babies also. Their babies, we have to take care, and we have to keep them separate from the person who has got the cold and cough at the house. And if they are coughing or sneezing, we have to be very careful on that. To prevent the cold from leading to the earache, try not to blow your nose, just wipe it. It's very important. Whenever we are getting the earache, we should not blow our nose, because our ear and our nose, those two are connected. So if we think that we are getting the earache, because of that we have to blow our nose out, so that can harm our ear. So we have to, and sometimes we can tell also to our children also, to our students also, you are getting the too much ear pain, okay, go and blow your nose, you will get some relief. But that is completely wrong thing. We should never do that at our home also, at our school also. Always whenever there is the earache, we should not blow our nose, just we have to wipe our runny nose. Next one, the stuffy and runny nose are also there. To help and clear the stuffy nose, what we have to do, the older children and adult can put a little salt water into their hand and sniff into the nose. Salt water, simply salt water we can sniff. This help to loosen the mucus, and plain water also can be used. If anybody can feel irritation in using the salt water, any other person can use the plain water also. Breathing hot water vapor also can clear the stuffy nose. Wipe the runny or stuffy nose, but not try to blow it. Blowing of the runny nose or stuffy nose is not really a good idea. Blowing the nose may lead to earache and sinus infection also, because when we blow and throw our runny nose out, by the time we can get some imbalance in our in our ear system also, hearing system also. For some time it seems like that we can't hear something. That kind of problem many people we feel when we get the stuffy and runny nose. So it's better to wipe our nose, not to blow it very in hard way. So now one quick remedy we will see that we can use in case of the cold, flu, runny and stuffy nose.
Hey there, health enthusiasts. Feeling under the weather? Today I'm sharing some effective kitchen remedies to help you beat cold and flu symptoms naturally. First up, turmeric milk, also known as golden milk. Turmeric is packed with anti-inflammatory and antioxidant properties thanks to curcumin. Simply mix a teaspoon of turmeric powder into a cup of warm milk. Add a pinch of black pepper to enhance curcumin absorption and a bit of honey to improve the taste and add soothing effects. Sip on this golden goodness to soothe your sore throat and give your immune system a boost. Next on the list is ginger tea. Ginger's natural anti-inflammatory and antiviral properties make it a powerhouse for fighting cold and flu symptoms. Boil fresh ginger slices in water to prepare this warm, comforting tea. Adding honey and lemon not only enhances the flavor, but also provides additional vitamin C and soothing benefits. Drink this to reduce throat inflammation, relieve congestion, and alleviate nausea. Another simple but effective remedy is a honey and lemon drink. Mix honey and lemon juice in warm water to create a soothing drink that can ease a sore throat and suppress coughing. Honey has antimicrobial properties, while lemon is rich in vitamin C, supporting your immune system. Sip this concoction throughout the day for continuous relief. Now, let's talk about garlic. Known for its immune-boosting and antiviral properties due to its high allicin content, garlic is a great addition to your cold and flu arsenal. Consuming raw or cooked garlic can help fight off viruses and bacteria. Add it to soups, broths, or even teas to enhance flavor and reap its health benefits. Lastly, try steam inhalation with herbs. Inhaling steam can relieve nasal congestion and soothe irritated sinuses. Boil water and add a few drops of eucalyptus or peppermint oil, or use fresh herbs like rosemary and thyme. Carefully inhale the steam by leaning over the bowl with a towel draped over your head to trap the vapor. This simple remedy can provide significant relief. Incorporating these natural remedies into your routine can provide relief from cold and flu symptoms and support your body's healing process. Remember to listen to your body's signals and rest as needed. If your symptoms persist or worsen, consult a healthcare professional for appropriate guidance. Thanks for watching. Stay.
So that is most important thing. Whenever if it persists for a long time, then we have to take the medical professional. We have to seek the value point from the medical professionals. Next one is the allergic reaction. An allergy is a disturbance or reaction that affects only certain person when things are sensitive to allergic. Every person is not allergic to everything, but certain people are allergic to certain things. So when they breathe in the pollen grains of the specific flower, or if they have eaten something that is they are allergic to, or they are injected with some specific chemical they are allergic to, or touch to skin, suppose dust mite allergy is also there. So these are that. So here it basically it happens to certain people also. In our school also, when we go, some students we get where they are allergic to different types of things. So we have to deal with them with very proper, we have to handle the situation with proper care. We have to deal with the situation with proper care. We have to make the sitting arrangement for the students in a proper way so that they can't get any kind of allergic reaction. So allergic reaction which can be mild or very serious, that include the itchy rashes or lumpy patches or the hives, runny nose, when they will start sneezing then and there. Burning eyes can be there, irritation in the throat, difficulty in breathing, or in maximum case asthma also can occur. So allergic shock also can occur, diarrhea also can occur. So in case of children, actually the people, the very little babies, they can be allergic to milk, lactose intolerance. So it is rare cause of diarrhea, but anyhow, if the person is allergic to anything, then diarrhea also can be caused. So in these cases, what are the different causes? Basically, pollen grain already we discussed, dust, chicken feathers, kapok or feather willows, then blankets or clothes or certain medicines also can be allergic. Here from the cats and other animals, specific food, especially the fish or shellfish or peanut or brinjal or prawn. So these are the different kinds of things basically we people are allergic to. Here are some home remedies we can use in case of allergy. these are the different things we have seen. Basically, aloe vera is very, very good for the skin problems. And now the next one is the abdominal pain. There are many causes of abdominal pain, like that is basically it can affect the intestine or can come from other causes like the kidneys, liver, gallbladder also, and the fallopian tube in case of women also. But basically abdominal pain, mainly it happens due to the indigestion. And if it is happens in case of the indigestion, so the acute infection is there. So then and there, what are the basic symptoms we can see? We can see the vomiting. Many people, especially children, have the occasional stomach upset, or often it can be stomach upset, diarrhea and vomiting can be at a time. So it is not that much serious, but if it persists for long days, or if we see any pus or any kind of like blood in the vomited thing, then we have to seek the medical help. Vomiting is the danger sign, and if it causes the dehydration for long period of time, severe vomiting for 24 hours after giving medication also, like simple medication also, if it is not going down, or the color of the vomiting is getting changed like dark green, brown, or it smells very badly, so then also we have to seek the advice from the medical help. So to help control basically vomiting, if it is very severe, we can take a sip of tea, but not the milk, and adding lime and ginger also in the tea can be helpful. Sip a cola drink or ginger or ale also. Some herbal teas also like the chamomile, or it can be helpful. For the dehydration, we can take the ORS or the dehydration drink also, but as soon as possible, we have to consult with the doctor. The next one is about the dehydration. Dehydration is the thing where we can get the dry mouth, rapid breathing when we run very fast for basically everything. Everyday morning when we go to our workplace, after reaching there, what we do basically, we take a sip of water. I think everybody does that, because we run, otherwise we will get late. And when we will get late, what is going to happen? Maybe there will be two late coming, 3 late coming, and then there will be salary cut. So because of that, we run like anything. And when we run, so that time thirst will occur. And when the thirst will occur, it will create the dehydration. And so that's why in general case, it is not at all a alarming thing. But in some cases, when the too much diarrhea is there, or there will be blood in stool, or diarrhea for more than 3 days, inability to eat anything, loss of appetite, then we have to take the we have to seek the medical advice. And what kind of home remedy we can use with the sugar or salt? We can boil the water and put it, and some baking soda we can keep in there. It is already available at our house, and just to increase the taste, we can use some sugar and honey also. And before adding the sugar, we have to be very sure that the person is not suffering from the diabetes also. Because if the person is suffering from diabetes, we have to avoid the sugar. If the person is suffering from high blood pressure, we have to avoid the salt. After that, as a remedy, we can use the fruit juice, natural fruit juice, coconut water, mashed ripe banana if available. It provides the potassium, and it will really help not only the children, in case of the like an adult also, it helps to get rid of the dehydration. The powdered cereal and salts are also very much helpful, or cooked smashed potato also very much helpful in this case. So boil it, we have to boil it, and we have to make one porridge from that. So we can make one porridge, and slowly we can eat it, so that we can get rid of that. So the main causes of diarrhea also like that, poor nutrition, worm infection can be there, viral infection can be there, intestinal flu, bacterial infection, any kind of worm infection, side effect of certain medicine like the ampicillin, tetracycline, inability to digest milk like the lactose intolerance, it can happen. And when the diarrhea and vomiting both will occur together, and if it will last for more than 4 days, so then we have to seek the medical help. Or frequently, if the vomiting happens and after giving simple medication also we are not getting rid of, then also we have to go to doctor immediately. So there are some home remedies we have to discuss about the diarrhea and vomiting. So these are the basic things we have seen in case of these are the very good home remedies means we can use. Basically, we have discussed about the common sickness. Now, Manoranjani ma'am will deal with the home remedies for different common sickness. What we can use for.
Yeah. Thank you, ma'am. Good afternoon, everyone. So, second unit, it is home remedies. Now we were identified a common sickness. Now, what are the remedies for home remedies for the sickness? So here we first of all start with the learning outcome. So here, what is the learning outcome? And they identify and they explore and again they apply that in their real life situation. So here application is coming. They apply these remedies in their real life situation. So there they can interact with doctors, that also Ayurveda and even Naturopathy. Naturopathy is one of the earliest section of treatment actually which we had earlier. So that is the learning outcome. They are able to apply that in the real life situation. So knowledge evaluation, the children, they are able to explain about the common sickness and the remedies for the common sickness. So they must be able to understand and they are able to explain after studying this portion. And then the performance evaluation, they are able to demonstrate how to make different remedy step by step. So how to prepare a home remedy, or even what are the steps behind applying this particular medicine. So they are able to demonstrate that after studying this. And now teaching aid, and that also can be given as an assessment. What are the remedial measures and how we are able to apply that in our real life situation. So the training methodology is, and it is interactive session, discussions are there, and they can interact with the people like doctors, naturopathy doctors and ancient people. So they can interact with them. So and the book activity, and they can write about the name, the place from where medicine can be purchased. So even they can explore their surroundings, they can identify the plants. That is also possible. Next slide, ma'am, please. So objective is explain the home remedies. So they explore and they apply the home remedies. So whatever they are getting. And they learn step to create the remedies at home. So there comes the application level. They apply these home remedies in their life itself. And next slide, ma'am. So home remedies for common sickness. Home remedies, in the home remedies, the common sickness we already identified. The first one, I think it is cold and cough. If a child has cold and cough, actually crush 10 to 15 leaves of tulasi, give 1 teaspoon of this juice mixed with honey or jaggery 3 times a day to babies for 5 days. So for the babies, it is a very good medicine. It is tulasi, which is there in our yard nearby only. So with tulasi or with jaggery, they can have it. And heat 4 tablespoons of coconut oil, crush 1 tablespoon of camphor, dissolve this in the oil, keep it stored in airtight bottles. This can be rubbed on the chest or throat of the child to relieve congestion. This can also be used for any muscular pain. Coconut oil with camphor, and we store it, and camphor we will crush it and we will put it in the oil and we keep it in the airtight bottles, and then we apply that on the throat, and even it will help us to relieve from the muscular pain also. So next one, these are the few examples which we are explaining, and which is, you will be getting it from the book. Next slide, ma'am, please. Next one is home remedies for home, again the cold and cough. If an adult, now we were talking about the children, now adult has cold and cough, boil a handful of fresh eucalyptus leaves into 2 glasses of water till only 1 glass is left, and strain this water and add sugar. Drink this for 5 days, thrice a day. This is a home remedy. Another effective medicine for cough and cold is Eucalyptus aspera, and it is a white plant with white bell-shaped flowers. Boil 1 handful of fresh leaves in water with a pinch of turmeric powder. Inhale the stem. It helps in relief of congestion. And Vasaka Adusa Vasak. Boil a handful of leaves in a glass of water until the water gets reduced to half. Add 1 tablespoon of honey. Give thrice a day for 5 days. This is for the adults. So these are available nearby even at home. So this can be used to relieve the common cough and cold. Equal quantity of powder of black pepper, long pepper and dry ginger 1 or 2 gram mixed with honey 2 or 3 times followed by tea or warm water. That is another remedy. These are the 3 remedy which has been given for the adults. Next slide please, ma'am. Again, the home remedy for sinusitis. Soak a piece of turmeric in castor oil or burn it. Inhale the fumes. Burn a few peppercorn and kali mirchi and inhale the fumes. That is one remedy for the sinusitis. Mix together half a cup of bitter gourd juice, half a lime and 1 tablespoon of honey. Drink 3 times a day for 5 days. Another remedy. Then sore throat. Crush fresh ginger to get 1 tablespoon of the juice and mix this with equal amount of honey. Take this every 3 hours. This is very soothing for the throat. Boil some water, add the juice of 1 lime and sugar or salt. Take this hot once every 3 to 4 hours. They have to drink it. Boil a glass of milk with a pinch of turmeric and pepper powder and drink it hot at bedtime. That is another remedy. I think the children, they can experiment in the school. They can prepare it and they can experiment that in the school, and it will be, I think really the children, they will be getting better understanding while they are preparing it. Next slide, ma'am.
Next slide is video, ma'am.
Okay. These are some of the remedies which showed in the video. Children can prepare videos, and I think the home remedies, that again depending on that particular place. In each state, I think there may be even more than natural remedies are there. So the children, they can experiment, they can interact with the old aged people, they will be getting better ideas, so they can make better videos, and even the children, they can make PPT also, so they get better understanding, so they can follow these instruction also. Now next is this common sickness and remedies. Cramps and stomach aches due to internal worms or indigestion, for even abdominal pain. And what shall we do? Roast and powder cumin seeds or jeera seeds. Take 2 tablespoons with warm water 3 times a day for 2 days at the most. This can also be used with curry or mixed with buttermilk. if pain persists of increases, seek medical help. While we are using this, but even when the pain and the symptom persist, then surely we need to consult a doctor. And the advantage is this kind of home remedy, it won't give any side effect. So that is the better advantage. Now next is grind 1 or 2 leaves of ginger of angel's trumpet and soak them for a day in 7 tablespoons of water. That is another remedy which we will be getting for the stomach, abdominal pain, or even stomach ache. Next slide, ma'am, please. Okay, the dosage. Okay, dosage between 10 to 15 days for this angel's trump for the stomach problem, and that can be used for 10 to 15 days every 4 hours, and this is only for adult. Angel trump is poisonous, so to be taken in recommended dose. So if you are taking more of this, and certain plants are like that, certain plants are poisonous, so we need to be very careful and use these with expert advice. That is also there. So make the children aware about that also. Next slide, please, ma'am. And again, these common remedies for fresh cuts and wounds. Wash the cut well with clean water. Wash a piece of fresh ginger and grind it. Apply on the cut and bandage it with a clean cloth. Do not remove the bandage till the cut has completely healed and the ginger come off on its own. Keep the bandage completely dry. If you get Dettol, mix it with water and use this solution for cleaning. So this can be applied for cut and which is not very severe. If it is very deep cut and the blood is coming out, then surely we need to consult it. Wash the affected area with clean warm water and apply turmeric powder over the area. That is another remedy. Clean and apply turmeric powder every day. And, garden cactus can be used to clean wounds where there is no boiled water, no way to get any. This garden cactus also helps to stop a wound from bleeding because the juice makes cut blood vessels squeeze shut. So give a dehydrated drink to all persons having diarrhea. Okay, so this is another for cut and good, and even for diarrhea it is coming out. Next, ma'am. Cut a piece of the cactus with a clean knife and press it firmly against the wound. When the bleeding is under the control, tie a piece of cactus to the wound with a strip of cloth. After 2 or 3 hours, take off the cactus and clean the wound with water which was boiled and cooled and soak it. Next slide, ma'am. And again, home remedies for clean ulcer. When an ulcer is clean without any pus, boil 1 ink nut in glass of water, strain the water and wash the ulcer with it. And then rub the nut on a clean surface, apply on the ulcer, keep the ulcer clean. When we have ulcer, then we can do this. And the picture also has been given with the ulcers, we can check it. Next. And then boils and abscesses. When a boil is painful, apply a paste made of soap and turmeric powder. Turmeric powder is antiseptic. The boil will burst fast and burn quickly when we apply the soap with the turmeric powder. Apply castor oil and boil. Cook some rice flour with the turmeric powder. Apply this on the boil. Tie and clean cloth. The boil will burst within 12 hours. So this, I think it is proved, and so we can test it. After the boil is burst, treat like an ulcer with pus. So now ulcer in mouth or tongue. Ulcer in the mouth or tongue are often caused by not eating the right kind of food. These ulcers are painful and the person does not feel like eating. This leads to more malnutrition. These ulcers can be made less painful so that the person can eat his food properly. Only proper nutrition can cure these ulcers completely. The following remedies help making the ulcers less painful by forming a protective coat on the ulcer. Grind the bark of the banyan tree. Put this juice on ulcer. Chew some guava leaves before eating. The leaves have pectin in them. This coats the ulcer and make it less painful. Guava leaves are good for diabetic also. Tender leaves of guava. So it is not having any side effect. Apply the paste of the haritaki on ulcer. So that is another one. I think that now we can see the video. Okay, we have seen some of the home remedies. Home remedies again for stomach ulcer and heartburn. Person with stomach ulcer or heartburn should avoid spices, hot water, tea or coffee, smoking, and alcohol must be avoided. Soak some poked rice in water for one night. In the morning, add 2 tablespoons of fenugreek seeds to the soaked rice and eat it on an empty stomach before breakfast. And this was one of the breakfast usually olden times people used to have. Fresh ash ground juice taken every morning helps in relieving stomach burn. So these are some of the common remedies. So where we can take care of our health, and even mainly what kind of food we eat, that is most important. And for short period relief, and we can apply all these things. Next slide, please. Now, home remedies for common sickness. Dilute 1 glass of plantain stem juice with 1/2 glass of water and drink it 3 times a day. The juice is alkaline and neutralize the acid in stomach, acidity. So this is plantain stem juice is good for acidity. Aloe vera can also help treat stomach ulcers and gastritis. Chop the spongy leaves into small pieces, soak them in water overnight, then drink 1 glass of slimy bitter liquid every 2 hours. Eat 1 ripe banana after every meal, and that is very good. And eating banana is good for after the meal. It is good. That's why earlier we were having banana with our diet. Boil rice with milk or curd without any chilies and spices is recommended. Pain after or in between meals can be taken care of by drinking either cold milk or even plain cold water. That also help us to avoid acidity. Next one is fungus infection of skin. What are the remedies for that? Take the leaves of cassia alata and wash thoroughly with water. Grind it and apply the juice thrice a day for 7 days. So this is one remedy for fungus infection. And chicken pox, spread neem leaves on the bed of the sick person Neem leaves are cooling, antiseptic, and help in relieving itching. And I think usually people use it. Boil neem leaves in water, bathe the sick person with this water daily, and bath is good. And taking bath in this neem leaves, boiled neem leaves water, it is good for chicken pox. And next, ma'am, slide please. And home remedies for scorpio sting, and cut a piece of onion and rub it on the site of the sting. It helps relieve the pain. And grind up a small pitch of potassium permanganate with equal amount of citric acid. If you do not have citric acid, you can add lime juice. Collect powder in paper and spread it over the exact site of sting and add single drop of water. This will help in Scorpio sting. And that also usually people get, especially those who are there in the agricultural field. And next, ma'am. Okay, tender. Next point, ma'am. The previous next point. Okay. And tender skin may get badly burned, so spread the powder only on the sting. So that is also very important. The skin may get affected otherwise. So now is worms. Papaya seeds can help get rid of intestinal worms. Although modern medicine often work better, papaya seeds must be dried in shade, powdered and kept it in the bottle. 2 teaspoons of powder are mixed with a glass of milk. Drink during the bedtime or 3 consecutive days. Okay, so worms, and I think papaya is good. Even the papaya tender leaves, and that is also good, I think, for dengue fever. So drinking the water of that particular leaf, I think that is good for the dengue fever also. Now home remedies for threadworms. Grind neem leaves on to a fine paste for 1 week. Take it, marble-sized ball of this paste every morning on an empty stomach. Do not take this for 2nd week. For the 3rd week, take neem leaves again as before on empty stomach. Chop finely crushed 4 cloves of garlic and mix with 1 glass of liquid. That is also good. For pinworms, drink 1 glass daily for 3 weeks. Tapeworm, grind 1 betel nut with a small glass of milk. Take it early morning and do not give it to children. Take a handful of ash ground seeds and grind them. Eat it in the morning on an empty stomach. After 2 hours, take castor oil. So these are good for the threadworms. And next is dissolve a small amount of asafoetida in water and drink it on an empty stomach once a day for 3 days. That is also good for the worms. Now, jaundice and hepatitis. Okay, Philanthus niruri, a small wild plant, have small berries under them. Take a whole plant and grind them. Take it empty stomach early in the morning. It helps prevent vomiting, and the sick person can eat his food after an hour after drinking this. Ellipta prostate alba, the leaves of this plant can be cooked and eaten once a day. Boil a 34 handful of leaves in glass of water along with a spoon of castor oil. Add 2-3 cloves of garlic and give it to the sick person. It helps prevent vomiting and stool and urine become normal colored. Now, home remedy for dandruff, and usually people are facing such a problem. Apply lime juice on the paste of neem leaves to the hair and scalp. Leave it for 1 hour, then rinse with plain water. Avoid using toilet shampoo to wash hair. Do this once a day for 1 week. Repeat after 15 days. You can ask the children to test it. They can experiment it. Now, toothache. Crush 1 or 2 cloves and put it in affected tooth. Let juice remain in mouth for some time. If clove oil is available, soak a simple piece of cotton in clove oil and put it in the affected tooth. So that is a very good solution for the toothache. Chew 1 or 2 cashew leaves and let juice remain in the mouth. That is another remedy. Garlic with lukewarm water with salt as and when required. That is again another remedy for toothache. Next slide, ma'am. We'll watch a video now.
Cloves are aromatic flower buds which are widely used in cooking as well as medicine. Cloves are traditionally used for maintaining oral health for their analgesic and antimicrobial properties. The antioxidants in cloves are known to support liver health and protect against oxidative stress. The aroma of cloves is known to have a soothing effect on the respiratory system. It relieves respiratory conditions such as asthma and coughs. Oil extracted from cloves is traditionally used to relieve pains associated with arthritis or muscle aches. Cloves stimulate the production of digestive enzymes which aid in better digestion. Natural remedy for toothache. Mix some clove oil with a carrier oil such as coconut oil. Make sure you apply this oil mixture exactly on the gums or teeth which are painful. This provides instant and temporary pain relief from the affected gums or teeth.
What we explained have seen in this video. Now some helpful home cures, plants and methods of their uses. Here are some guidelines on the collection, storage of and preparation from the medical plants. So children can do this and they can write about how to storage, how to collect it, how to prepare this. So they can have a note, and even they can have a PPT on this. And even the children, they can make video also such a way. So the understanding will be more. So now collection, how to collect it. The two important factors which influence the properties of the medical plants are the soil in which they grow and the time of collection. Only fully grown or mature plants which are grown during the season should be collected. The plants gathered should be in their normal characteristics like taste, color, smell, and free from insects, poison, or dirt. These plants are usually collected in the autumn season. Before preparing anything, all the herbs or plants should be washed thoroughly. So this guideline is important. So children can make these kind of collection guidelines. They can make it even more. And storage and labeling. Before storage, the plant must be dried to make it moisture free. They should be stored in a well cleaned and dry container with covers. They should be placed in cool, dry place which is away from smoke, insects, water, and dust. If storage medical plants develop fungus, it should be thrown away and not used for medical purpose. Plants generally lose their effectiveness after storage for 1 year. So this is another information, such a way the children, they can note down the important information for storing, collection, etc. They may be getting better idea, I think, maybe discussing with the elderly people and even the doctors. And these are some of them. And now plants and methods of their usage, preparation of some medical plants. Now here we have seen collection and storage. Now how to prepare it. Kalka chutney, a paste of internal use. And there are two methods of preparing kalka, from green tea plant and from dried plant. Kalka should always be prepared fresh. Example, pudina kalka. Pudina chutney, we are talking about the chutney. Now the preparation, the how to prepare. Wash the green plant, drain the excess water, and brush it with pestle and mortar until it has a pulpy consistency. Place dried powder in a grinding slab, add water gradually and grind to a pulpy consistency. Collect the medicine in a suitable vessel. The amount of ghee, honey, and gingerly or sesame oil, if required, should be mixed and double the amount of kalka. It should be taken 4 times a day. Such a way the children, they can prepare about all these kind of medicinal plants usage. So this is one example only. Such a way they can prepare everything, I think. Next slide, please, ma'am. So they can prepare this also. Plants and medicines of use, preparation of some medical plants. Lepa, And this is another example which has been given. A paste of external application, LEPA, may be cold, hot, thin, thick. It is prepared by crushing the part of the plant being used in Swarza, the part of the plant being used in crushed, and the juice is extracted without adding any water, oil, water, ghee, curd, milk, etc. The amount of plant used must be enough to cover the affected part. It should be applied against the dried direction of the hair. The affected body part must be covered with lepa up to thickness of 1 centimeter once a day only. It should be removed from the skin when it is absolutely dry. This is another preparation. So make sure that the children, they prepare such a way how to prepare the the medicine. Decoction. Decoction, it also be there in the textbook. I think because of lack of time, we'll leave it and you can read from the textbook. And plants, and again preparation of some medical plants, powder. How to make powder? Now we have seen earlier. We have seen this chutney kind of things. Now we are making the powder. Dried parts of the plant to be used on the grinding slab or with pestle and mortar and sweep through the clean cotton cloth. If jaggery is to be mixed with the powder, the amount should be equal to that of the powder, honey and ghee. The quantity of the powder to be mixed should be double. If mixed with milk or water, the amount of powder to be added is 1/4 of the milk or the water. So very beautifully explained. So let children make such a preparation chart very beautifully. Now how to prepare ointment. Warm oil or ghee initially, then add resin before you remove from the heat and strain through a clean cotton cloth. Add finally powdered plant and mix very well to a homogeneous non-gritty consistency. Do not add resin together with oil and ghee at the beginning, as this will make the consistency of the ointment hard. So now for green drug, select green plants with which are free from insects and infects. Wash these with water and drain off excess water. Cut into small pieces and grind slightly. Squeeze through a clean cotton cloth and collect the liquid in glass. For dried drug, obtain clean dry powder of the drug equal or double the amount of water and allow to macerate for 24 hours in an earthen pot or glass. Strain through a clean cotton cloth into another earthen pot or glass. So here the children get an idea how to prepare this the medicine. So now I think some natural ingredients which we can use in our home. First one is honey. Mixing 2 tablespoons of honey with herbal tea or warm water would cure your cough. Salt. Mixing 1/4 to half tablespoon of salt with 8 ounces of warm water can help to relieve irritation from throat. Turmeric. Mixing 1 tablespoon of turmeric in warm water to treat respiratory conditions, bronchitis and asthma. Ginger. It has antibacterial and anti-inflammatory properties. It boosts immune system and provide relief from pain and discomfort. You can add it in tea. It is beneficial for dry cough. And then mint, pudina. Mint has been long known as herbal remedy for calming stress and anxiety and promoting restful sleep and ease an upset stomach. And then lemon. Mixing lemon in warm water would help with removing the blockage. It also helps to reduce irritation in the throat and lungs, as well as cleaning the airway and relieving dry cough. These are some of the remedy. Such a way the children, they can write the name of the plant or ingredient, and then they can make the use. So this kind of table the children can prepare. It will be helpful for them. So by the way, I was just thinking that while we were having this COVID-19 and we were using actually a remedy, or even not for getting this infection, we were using in Kerala, actually we were using this black cumin seed, that is black jeera, and we were drying it and then crushing it and putting it in a cotton cloth, and we smell it. So that was good for getting relief from this COVID actually. So these are some remedies. So which is we explain here in the textbook, and even there are many. So the children can collect such information and they can make a chart and they can prepare it and they can I think publish it also. So that will help the children to understand better. Anyway, we just completed. Thank you. People having some queries, we'll wait for that.
Yes, ma'am. Jyoti, ma'am.
Yes, Kali ma'am. Yes, Manoranjani ma'am.
Yes, ma'am.
So I have learned so many things that without going to doctor, we can cure ourselves, cure many people, others also, with their available material at our home.
Yes, ma'am. Definitely.
And I today itself learned that Ayurveda and aloe vera are quite very much linked with each other.
Yes.
I do have so many plants of aloe vera, but they are like plants for us, not like a medicine for us. So I think many of the people not aware of the beneficials of that aloe vera, plant aloe vera. So if we do have many things at our home, then why to waste our energy in searching of doctors?
Yes. But in serious case, we have to go, ma'am. There is no choice. If
serious issues, we are supposed to consult the doctor. But initial stage, I think we can first of all try with the home remedy.
Sure.
And I think the home remedy is basically related with and what is available in our particular area. So that will help us.
Correct, ma'am.
Mostly.
Yes, I think many of the times whenever I see these guidance, I really feel to opt for this field. So it was indeed, I have read so many comments on YouTube also. They all were so happy and saying that it is indeed a very useful information. Might be they will apply in their routine life. And the session is for that reason also, that every common people will apply on their routine life. So that we can take the benefits. Nature has given us so many things that we can take the benefits from that.
Yes, ma'am.
So anything, Manoranjani ma'am, Pyali ma'am, you want to add? Although you have added so many things.
I think, see how to live properly, with neatness and tidiness. That is more important, and even what kind of food we eat. That is also very important, that, we won't be getting any kind of diseases. Neatness,
right.
Yeah, and healthy food. These two are very, very important in our life, then, so that we won't be getting any kind of diseases. Even minor things like cold and cough and all, and we have home remedies also.
Yes.
That is
one more thing is also their physiological factor, that is the stress and tension. Means we have to train ourselves in a way that whatever the situation it is, we will not take any stress. So that's the best way to keep all the diseases away from us. That is the best thing. We have to train ourselves, and we have to teach our students also, because the life what is going to come in future, that will be more competition and competitive life. Our students also has to be they have to deal with that kind of situation. So as a teacher, we are doing that actually. How to deal with the stress-free situation.
Discipline in our life is also important, and yoga practices are also important. And spirituality has a role actually to get peace of mind.
Yes, ma'am. All the words you both have said is true that in the competition area, like today is quite very high competition. Even a student wish to take out the 110 marks out of 100. And even if they are getting 1 marks less, it is very stressful. It is very unacceptable for them.
Yeah, ma'am.
Acceptance should be also there.
Yes.
And I think major reason for the stress is that we are not accepting. We are just expecting.
Yes, that's the correct
Very
thing.
true, ma'am. Very true.
Very true.
So thank you so much, Manoranjini ma'am, Pyani ma'am. You just connect with me. Anything you want to add for the further or future? Soon we will do another session on our subject, because I think we are adding some quality, not only about the subject.
Yes.
We are adding some quality in the. We are trying at least. Not if it is not affecting or not having any impression. I don't think so.
I think, ma'am, this is a compulsory subject, no, ma'am, in our curriculum.
Yes, ma'am. So thank you so much, Manoranjini ma'am, Pyani ma'am, and all the audiences who have connected with us. Thank you so much. Stay connected and stay healthy. Stay mentally and physically fit. It is very necessary for us. I think mentally is much more necessary.
Yes.
So we should wind up now.
Any question from the audience side? If any question is there.
Everyone is appraising us just.
Okay.
Everyone is saying that it is very informative and very good session.
Okay.
Thank you.
I think all those questions might be, everyone is having like that, the precautions, the cureness of the common problems we do face, like cold, cough, mild fever, ulcer, little bit burn, little bit cuts. We might if a child is there in their family, it might like he got very frequently injured with some small things.
Yes, ma'am.
And if possible, we can share that link of videos to the participants. If possible, I think we can share it.
We do have a link with us. I'll do. And, I'll also share some other things with the participants also, like attendance and feedback.
Okay, ma'am.
Okay.
Okay, ma'am. Thank you, ma'am. Thank you.
Thank you, ma'am. Pyali ma'am, see you soon. It was quite good interaction, and happy to see you, both of you.
Thank you so much.
Thank you, ma'am. Thank you so much.
Very nice to see you, ma'am. Thank you so much.
Yeah.
Bye.
Good evening. Namaste.
Good evening. Namaste. Shall we leave?
Yes, ma'am. We can leave.